members of the Kerala Management Association and fellow management professionals. Good afternoon. It gives me immense pleasure as a member of the KMAC Management Committee to introduce a visionary leader whose journey exemplifies entrepreneurial excellence and transformative impact on Kerala's business landscape. Today, at the ClaySys KMAC Annual Management Convention in Cochin, please join me in welcoming Mr. Nawaz Meeran, Chairman of Group Meeran and former Chairman of Eastern Condiments. Friends, Mr. Nawaz Meeran transformed a modest family spice venture into Eastern Condiments, a national powerhouse in spices and condiments, achieving over 3 decades of remarkable growth through disciplined innovation and market expansion. He has served as CEO of Eastern Condiments for over 3 decades and continues to have an active role in the board. Yes. Under his leadership, Chairman of Group Meeran, he oversees the growth and new investment within the group, which manages several entities, including the well-known Eastern Condiments Private Limited. Under his stewardship as former chairman, the company earned widespread acclaim. Before it had this strategic alliance and joined Morkla in 2020, scaling business from Kerala's local roots to pan-India prominence with a focus on employee empowerment and industry collaboration. Ladies and gentlemen, Mr. Nawaz Meeran's expertise and success not only remind him of business field, but also in many other areas as he led many industry organizations with a client. And one of the many, he was the president or he was the chairman of the Confederation of Indian Industry, Southern Region, and has held various executive and council positions promoting industrial and economic development. A commerce graduate with a passion for ethical entrepreneurship, he champions disciplined decision-making, fostering internal team ecosystem where mistakes fuel growth and protecting sector margins to sustain livelihoods across supply chain. Ladies and gentlemen, his expertise not only remained in business and in this leadership role in industry organization and multi-faceted personality that he was in the sports development and developing especially the football associations and football infrastructure. Let me talk a little about his association there. He was unanimously elected as president of the Kerala Football Association in 2023, where he is responsible for promoting football development, leading the association's vision that actively involved in strategic planning and growing football infrastructure and talent across Kerala. Through the Meeran Group Sports Arm, the Scoreline Sports, he is the principal backer of Super League Kerala, and initiatives set to invest significantly in Kerala's football ecosystem, building stadiums and supporting football leagues. The group also supports, apart from football, basketball and cricket development in Kerala by funding new leagues and sports infrastructure. My association with Mr. Nawaz Meeran is through roadshow, and I know Nawaz as a Rotarian with compassion and empathy. The support of more than $4 million through the Rotary Foundation has resulted in an advanced cancer care facilities at the Government Hospital in Nagara. This is one of the many philanthropic activities of Mr. Nawaz Meeran. It is an honor and privilege to present before you a person who's involved in multiple diverse areas like a successful business leader, implementer, sports enthusiast, and administrator, philanthropist, and legendary. Ladies and gentlemen, please welcome Mr. Nawaz Meeran. Thank you.
Well, thank you, Mr. Balagopa.
Tough to have a talk in the after session of dinner, lunch. Thank you once again, Team KMAC, for inviting me to this function. Generally, we talk about holistic health and vacation is one part of that. So, what do you mean by vacation? After you get into a hectic schedule of your normal routine, once in a while you feel like you need to rejuvenate and then come back and be a bit more creative and efficient as far as your normal work is concerned. So that can be made as a daily routine. When I say daily routine, on a daily basis, most of us go through grilling and tough work environment. And then by the end of the day, you should actually get some sort of relaxation. When I say this is all the more matters when it comes to our kids. There at the school, during our days, we had a physical education period wherein, we were allowed to do sports activities. Now, these days, what I've seen is teachers want to complete the portion, and portions need to be completed at least halfway through the year, and there will have at least 2 times of repetition on the same topic so that the kids they don't lose out on the marks. Parents used to talk to kids saying that if somebody wants to go and play outside, they obviously will say that exam is coming, go out and take the book and keep studying. So this has actually created a lot of issues in the society wherein we have kids who doesn't have the spirit of survival. Anything that comes in as a failure, kids obviously find it difficult to manage it. And mostly these days, if you know that beyond 2, there are no kids at home. It is only either one son or one daughter, or one son, one daughter in the family. So entire family pressure from the parents, from the grandparents, it's all on the kids. So that put a lot of pressure on kids so that their effort is to make sure that they want to cope up with the expectation of parents. When I say the expectation of parents, if the dad wanted to be a basketballer, he would make sure that he goes for basketball training. But the intent of the kid is to get to cricket. That is not being allowed. So likewise, there are a lot of mismatch in the way we look at what's happening to the youngsters. So there are ways and means with which we are supposed to actually build the next generation. In fact, my exposure to sports was way back in 2018 when I was selected as the president of Idiki Football Association. So it's like if you have some money, somebody wants to make you a president, you can be a president there. I didn't have much of background on football. Me being in a boarding school, my warden always used to come and look at kids who are sitting in the gallery. And he used to make sure that, kids, everyone has to be on the field. And that drew us to get into different sports activities. That is the only experience of mine in getting into football. So the first tenure got over, and when it came to the next tenure, I said, I don't have much to contribute. Then why should I continue as the president? I don't have much to contribute. Then somebody, a very sensible guy within the forum, told me that this is an emerging field. All we need to do is that nobody takes the ownership of driving this exercise. So if you have the courage, if you can create a vision on what can be done as far as football is concerned, it is going to make a huge difference. That paved way for me to create 5 academies in the district of Idiki. And we had one academy in Kumali where, from the academy, a boy got selected into Chennai FC, which is, these days the salaries that's been offered by the football clubs are huge. This boy was offered 30 lakhs as remuneration. That opened the eyes of people who were actually managing the association. So now it has come to a stage where money is there. All we need is right talent and possibility for kids to get into footballing as a profession. So this actually paved a way for me to think in what all things that we need to do as an association to make sure that we create better talents in the sporting environment. You know the theory of constraint. So it's been told that a kid has to go through at least 48 competitions, match opportunities in a year so that he excels and he actually better his competitive skills. But the problem in the state or in the country is that you don't have much of competition opportunity. So if you want to have competition opportunity, associations should be willing to have matches happening under the age of 13, under the age of 15, 17, 21, and then the normal league that happens in every district. But because of lack of money, what happens is these sort of competitions will be done for the sake of conducting it. Because as an association, you're supposed to perform X number of competitions, and that competitions will be done over a period of 2 years. Create SLK, Super League Kerala, as a brand in Kerala. You don't have stadiums. What are you going to do? I said, I will just kickstart. And then everything will fall in place. That's my experience. So initially we started with 4 stadiums. Then came to the second season where we had another 2 added. So this year, the second year, we did 6 stadiums, matches in 6 stadiums. And most of the stadiums were full. And in the first year, I talked about ticketing as a major revenue, and nobody came in. We, in fact, we went to all the academies, asked them to come and view the match on a free basis, in certain cases, concessional basis, but people were not there in the stadium. But by the end of the first season, we could see that this is slowly going to emerge. And then came the second season. So in the second season, right from the beginning itself, we had 100% capacity holding, people coming into the stadiums throughout the game. And that really helped us, look at football into a much better way in the coming future. So what actually drives an individual? For me, in schools, we have basketball, we have football, we have hockey, cricket. In any team game, you create a spirit of being part of the team. Success and failure, it comes on, it keeps repeating. If you succeed in 2 matches, in another match you probably might fail. But this actually inculcate a sort of leadership capability into the minds of the kids, so that they get to see the society in a much matured way, which the society at this juncture needs. Because as of now, as I said earlier, if you have just one kid at home, it's been pampered by all the parents and the grandparents. So they want everything, they are actually getting whatever they want. And when you get to the society, you probably may not start getting it. A failure in the exam can be a major setback for them. If friendship, if you're getting disturbed as far as friendship is concerned, you get completely disturbed. So these sort of area, people get to be vulnerable, and this is the only way where we will be in a position to make them stronger. For me, I would say that 40% of the time consumed by a student or a youngster should go for sporting or related activity. And multi-sport activity actually strengthens him in a much better way. And that 60% should be concept-based. If your if your learning is based on concepts, then that stays in your head. I was just hearing Vinod Taragan talking about, you talk about trigonometry, and as the exam is over, you forget about it. Same is the case here. You have to bring in concepts into the mind so that they will be able to address difficulties and problems in the future, and that becomes part of the problem solving in their life. Same is the case with health. If they are involved in a healthy intervention as far as sports is concerned, they will have that sort of a leadership capability developed in the future. I'm telling you, the failure mode and approach, the failure mode resolution approach is what is going to create the entire change in the life of a kid. For me, what is going to be there in the future? I would say that footballing, not just footballing, every sports initiative need to be taken as a business. It has to be taken as, it's a normal business. If you take academies into consideration, I know academies in Kerala which charges 25,000 rupees a month, which means they're paying 3 lakh, a parent is paying 3 lakh rupee a year for a student to be in the academy. And likewise, 60% time spent on sports, 40% time spent on studies. Having said this, in none of these places, the results have not been onto the north. It has not gone to the north. The results have also been in the positive side of it. So this academy is coming up with the help of technology. We will be able to address issues related to fitness. We will be able to address issues related to muscles, strengthening tactical intervention. All these things with the help of AI, we'll be able to scan and create a better performer on the field. So this actually help kids to get to amateur sporting activities. Earlier I said that a kid need to have 48 matches played in football, 48 matches played in a year. At least 24 matches if we can provide him opportunity, he will start strengthening and he will start getting into the next level. If you look at African countries, they're all tied up with a 4th division club in some part of the European countries. So these kids have been recruited, and if you see players coming into the European football, this has all been scouted by the coaches who has been sent by the major clubs to Africa, and they have been trained and made a professional footballer there. I was also referring about the Japanese Football Association. Japanese Football Association has got offices in every footballing country. What they do is they send their person there, they work with the club, and they identify talents in Japan, and then they create opportunity for them to play in either in European league or in the North American league, wherever it is, the space is available. So what is there in the future for us? The best thing that has happened for footballing in this part of the world is Saudi Arabia has started putting huge money into footballing. So earlier, you know that during the 70s and 80s, our people used to go work in Saudi Arabia or any part of the Middle East. Very soon, we will also see our footballers, young professional footballers, being part of the Saudi Football League. And in India itself, now the recent transaction which has happened was Anwar Ali being bought out by East Bengal for 5 crores. His annual remuneration is 5 crores. So you'll come to hear about these sort of big money coming into the state by way of footballing. So for me, sporting is definitely going to be a profession. As parents, what we need to do is that we need to allow kids to get into the field, be it cricket, be it football, be it basketball, whatever it is. Let them start trying what they want to do, and that definitely is going to make a lot of difference in the family, in their future also. I'm not. The thing is that if you ask me, there are a lot of opportunities for us to create infrastructure within the state. Every panchayat is being asked to spend 5% of their budget for improving sports facility or creating sports facility. Every one of us, let us take it as our responsibility, talk to the panchayat members, talk to the municipal councillors, tell them that you need to create this as a priority, bring in recreational facilities within the smaller towns, and let's create opportunity for kids to get to the field. And a lot of corporates are lending helping hands, and that is going to make a huge difference in the way footballing is going to happen in Kerala. Thereby, we will be in a position to take, Kerala as one of the leading contributors for the talents for Indian team in the near future. For me, SLK is not just a brand. SLK is a spirit. The spirit that actually drives every football association to copy something. They didn't have anything to compare. Now Kerala is giving them Super League as the model. Super League is been, the ISL is been competing with Super League. So basically because the way in which we have portrayed Super League Kerala, others are trying it hard to get there. So what I'm seeing is that, I'm putting pressure. What is failing for sporting activity in the country? The major reason for the failure of sporting activity in the country is people there at the top of the association. There is no milestone and there is no end to the tenure. If somebody comes in, he contributes 2 year you can contribute. And after the 2 session, you have to move out. Once you move out, only others can come and contribute. So if you see in most of the cases, what happens is for 20, 30 years, the same people actually sits on top of all this association. And without any vision, without any milestone, without any target, without even having any idea of where the funding is to come. And they will also always keep blaming government for not having the fund. So it is a collective exercise which we all need to do. I'm not here to beg for money, but what I'm saying is we're all, we need to be dutiful as far as creating facilities throughout the state is concerned. And I sincerely request that we should take the lead and corporates should take the lead, and you should also fix a small portion of your CSR funding for sporting development activities. I'm not taking much of time. This is the future. Sporting is the future. And I'm sure that jointly we will be able to create a healthy world, healthy state. And I'm telling you one thing, even if nothing happens, you will be able to reduce on the cost of medical expenses, at least up till 60, 65 years. So that itself is a big boon to the state, and I appreciate hearing me at this juncture. Thank you so much.
Good afternoon, ladies and gentlemen. Now we move into the physical health track, the second pillar of transformation at ClaySys KMAC 2026. It's my privilege to introduce our keynote speaker and moderator, Dr. Krishnanath Gaitonde. Dr. Gaitonde is an accomplished physician executive, healthcare entrepreneur, and TEDx speaker. With a career spanning academic medicine, private healthcare, and health system innovation. He is a partner at the DPN Urology and Oncology Network and a co-founder of BeatCure Mindful Health, a preventive and wellness platform operating across the United States and India. He has previously served as Professor of Urology and Director of the Robotic Surgery Fellowship Program at the University of Cincinnati and the Chief of Urology at the Cincinnati VA Medical Center. With advanced training across India, Germany, Australia, and the United States, and formal leadership education from Harvard Business School and an MBA from the University of Cincinnati, Dr. Gaitonde brings a rare perspective that seamlessly integrates medicine, management, and systems thinking. His work consistently reinforces one powerful idea. Health is not a cost center, but foundational infrastructure for long-term economic and organizational performance. We are honored to have him deliver the keynote address and moderate this session. I would also like to warmly welcome our distinguished panelist, Dr. Bijoy Eratil, Joint Director Operations, State Health Agency, Kerala, Mr. Srivasthan Abarachidan, Managing Director, Inten Health Technologies, Dr. Nalanda Jaydev, CEO, Aster Medicity, Kochi. Together, this panel provides deep insights into policy, healthcare delivery, and innovation, offering a holistic view of how physical health systems can be strengthened for the future. May I now invite Dr. Krishnanath Gaitonde to lead the session.
So, thank you first of all to the KMA for giving me this opportunity. I'm excited to share some of my experiences with you. I've been a urologist and a surgeon for almost 30 years and have made the transition into preventive care. And I'm also excited to be part of the panel, which brings a huge amount of experience, diverse experiences, and I'm looking forward to the conversations we'll have after the presentation. So let me start by just taking you on a small journey. The journey does not start in a hospital or a clinic or a farm or a factory, but in a cave. And this is Grok and Ayu, and they are our prehistoric ancestors. So the whole thing is that when you look at them, in contrast to Grok and Ayu, we are living today in the most advanced, luxurious, and connected age, and yet we are more unhealthy, sick, and stressed. So if you look at their life, they had the natural rhythm of feast and fast. They did not count calories. They did not do any yoga. Now, when food was found, they feasted. When there was scarcity, they fasted. So they moved, they hunted, they gathered, and they rested. So that was how our ancestors did. So their body and their metabolism was designed for cycles of abundance and scarcity. So if you look at this small drawing there, whenever they got access to food, they ate, and insulin, which is a hormone which is secreted by the pancreas, which is an organ that we have, caused the body to store fat for times when they would starve. So this was a cycle, and that balance is what kept them healthy and fit. So let's look at the evolution of how the food and eating has evolved over the years. So we started with agriculture. That's a time when we learned how to grow our food. Then we went to industrialization, where we learned how to process the food, to store it. And today, now, we are in what's called as a supermarket revolution. So today we don't hunt or gather, we have an abundance of food and we are surrounded by it all the time. So, if you look at our ancestors, Grok and Ayu, they feasted occasionally, but we feast constantly. This is what has happened. Most of what we eat is refined carbohydrates. Most of it is ultra-processed. And these foods are the ones which drive insulin, which is what I told you is the hormone which our pancreas secretes, and that keeps it high. So what this results in is what we call as insulin resistance. And the insulin resistance basically leads to all the issues of chronic disease that I will be talking about. So what are these? These are basically type 2 diabetes, blood pressure, obesity, low testosterone, PCOS in women. And if you look at all of this, a lot of it is silent. So a lot of people have this and they don't even know that they have underlying metabolic dysfunction. And what is interesting, this is global statistics. Almost 2 out of 3 adult men, or adults, not adult men, 2 out of 3 adults have some form of metabolic dysfunction. That's a staggering number. Almost 70 to 80% will have some sort of metabolic dysfunction and not even know about it. So this is an interesting concept called as TOFI, that's thin on the outside and fat on the inside. And if you look at a lot of the subcontinent population, we'll see this. So basically, the key to understand is that just because you're thin doesn't mean you're fit. So it's 2 different things. Looking fit and being fit is 2 different things. So if you have normal weight, doesn't mean you're metabolically healthy. There's something called as visceral fat. What is visceral fat? That is, when the body stores fat, it can either store it outside or it can store it inside. So when it stores it inside, that's called visceral fat. And that's what is the dangerous fat which we don't see and which causes metabolic dysfunction and leads to all the chronic diseases like diabetes, hypertension, and things like that. So you don't have to look obese to be metabolically unhealthy. TOFI is a silent killer. People around us look fit, but they are metabolically at risk. So a brief perspective about what the economic impact of chronic disease is, just to give you an overview of how chronic diseases can result in the effect on the financial and economic side of the healthcare population. So if you look at it, we spend more on disease than on health. So United States, the annual spending is almost $4.5 trillion, out of which 90% goes to chronic disease and less than 5% goes to prevention. Now that's staggering. In India, about $150 to $170 billion per year is spent, out of which 60 to 70% goes to chronic disease. What is interesting is 55 to 60% is actually out of pocket. And I think, again, some of our panelists can shed light on that later on. Large burden of this is borne by families, and India has more than 100 million diabetics and 136 million pre-diabetic. We are almost known as the diabetic capital of the world. So most chronic illness is predictable and preventable. Treating disease is expensive, stressful, and late. These are the numbers. If you look at India, we spend about $110 to $150 billion on diabetes alone. Prevention protects the body, mind, and money. And as we live longer, avoiding disease matters more. So today, the life expectancy all over the world is going up, which means it's all the more important. The longer you live, the longer you're going to have to deal with chronic disease. So India is projected to lose about $4.58 trillion due to non-communicable disease, that's chronic disease, between 2012 and 2030. These are staggering numbers because if you notice, a lot of what I'm talking about is something that is potentially preventable. So besides the money impact, there's a huge productivity impact that occurs whenever chronic disease is there. So beyond medical bills, the combination of diseases causes a massive productivity drain. When people are sick, they're not able to come for work. Or if a family member is sick, then they can't come for work. So these are all the intangible effect on productivity which can impact the overall economic economic outlook. So there's a term called as disability adjusted life years. And what it is the total number of years of full health which is lost due to disease or disability. And if you look at the numbers, India is not too far away from the United States. So we've got 22,776 DALYs per 100,000 people for India, and the US is about 28,631. So the key point of this is prevention is better than cure. It's easier said than done, and that's why we are having this discussion today to try and figure out how to solve this problem. So I just want to touch a little bit on medications because a lot of us jump to medications as a panacea or the solution. So GLP-1s, which is all your weight loss drugs, which are all over the place in the US, in India now too, they form about 20% of US prescription drug spend, and the employer drug costs are rising annually. So the key is nobody knows what's the long-term outcomes of these drugs, and it really is not sustainable from the affordability point of view, whether you look at it from the employer perspective, insurance perspective, individual perspective. So I don't think this is a long-term solution. It's a very quick solution, obviously very attractive, but it has to be combined with other changes such as lifestyle and looking at modification of factors which can impact prevention of chronic disease. So let's look at the Indian diet. This is an ICMR study which came out, which said that 62% of daily calories from Indian diet comes from carbohydrates, and only 12% comes from proteins. So today, we are eating all kind of refined grains, we are eating sugars, and we are eating frequently. A lot of it is carb loading the system, which causes insulin to go up in our bodies, and that is what results in all the chronic diseases. So the whole thing is that we just moved from occasional carbs to constant carbs. So let me give you a small view into what actually is hidden sugars. So the sugars are around us all the time. They just go by different names. So if you look at this, a bowl of rice, that's equal to 14 teaspoons of sugar. That's crazy. So the point is that we don't realize it, but one plate of rice is 14 teaspoons of sugar. One slice of bread is equal to about 15 grams, that's about 4 teaspoons of sugar. And whether it's wheat bread or white bread, I think it's fine. Both have got carbs. So it's not that wheat bread is any better than white bread. Orange juice, same thing. Coke. So look at all these things. I think people don't overeat sugars. They overeat starches that make sugar. So it's important to understand that we are surrounded by this all the time. And even though they don't have the label sugar, they contain carbohydrates which drive the insulin and in turn drive the glucose and in turn cause all the chronic diseases. So let's redefine physical health. So physical health can be redefined as the ability to live a productive, intentional life free from preventable lifestyle-driven chronic disease. What it means is we have adequate energy for daily activities, we have stability, balance, recovery. We do easily what our prior generations would do. My father, my grandfather, great-grandfather, they lived healthy lives. They were able to walk, they were able to do daily activities without any issues. If you can do that easily, without getting tired, without getting fatigued, then you are in good physical health. And I think it's important to differentiate between what's called as lifespan and health span. So lifespan is basically how long do we live, and health span is how well we live during these years. It's a difference. So medicine has done a great job in increasing the lifespan. Our expected life expectancy has gone up, but we haven't done a great job in increasing the health span. And that's where I think the rubber meets the road and what we are trying to talk about today. So let me ask a question to the audience. So how many people in the audience, if you can raise your hands, regularly service your car? I see a fair amount of sprinkling hands there. That's pretty good. So how many people in the audience would be comfortable flying in a plane which has never been maintained? No brave souls there? Okay, so no hands, right? So in spite of that, most of us do not do any regular maintenance on our bodies, in spite of this being the most complex engine system that we own. this is a reality. I mean, we do it for other things, but when it comes to ourselves, we don't really take care. So why is this so hard to do? I mean, let's face it. I mean, we all know what we need to do, but why is it so hard to do? One interesting thing is there is no warning engine check light for all the chronic diseases. So if you look at diabetes, see, a lot of this is silent. You don't even realize you have it. Like if you have a fall and you break a leg, you know it's broken. But when you have chronic diseases, there's no check light that tells you something is wrong. We wait and wait for failure, and we only treat. We are reactive versus proactive. For example, when we look at diabetes, we check for sugars. And when your sugar has gone up, you already have diabetes. If we were able to check insulin levels, which is very easy to do, then we would know that insulin levels predate diabetes by almost 10 years. So if we were checking insulin levels and we saw that they were going up, you would know that you are headed for diabetes. But nobody does that. We only check for sugar levels, and by the time your sugars are gone up, you've already fallen off the cliff. And that's the problem. So we are reacting and not being proactive. So this is something that I strongly believe in, and I know, I have done this myself for so many years, being in practice for 20, 30 years now as a surgeon, that we do disease care and not really health care. So we really don't, so it's not disease care, but it's not health care, but actually it's disease care. So what's the big problem? 9 out of 10 show signs of metabolic dysfunction, so almost 70, 80%. Root cause is insulin resistance. Typical healthcare managing symptoms, not the driver, not the root cause. There's fragmented and confusing point solutions, apps, diets, no integrated system which addresses the issues and manages optimum health. So we are treating the symptoms, but we are not really treating the root cause. And that's just how the system is designed as of today. So what's a typical fitness journey look like? We've got apps, we've got diets, we've got symptom-led care of chronic conditions. So this is pretty confusing, and this is what we deal with today. So what's the elephant in the room? We know all this information. Why are we not able to apply it? And the elephant in the room is habits and accountability. So knowledge is not the problem, motivation is not the problem, habits and accountability are. So if I can tell you, you need to eat this, you need to exercise, we all listen, but it's very hard to make sure that we do it. And that's where the habits and accountability comes in. And I'll share some thoughts and some ideas that we, in my company that we do, some metabolic health program, what we've been trying to do to address this. And the key factor is when you nag somebody, it triggers defense mechanism. And I always say, if I'm eating something, if my wife comes and tells me, don't eat that bread, and my defense mechanisms come up and I get upset. So that's what happens to all of us. I mean, we try to, so we want to be helped, but we don't want to be helped. I think that's the whole thing. So I think that's the key. And willpower always runs out. You cannot depend on willpower. We say, I've got self-control. I wish that was true. So how does proactive, preventive health actually look like in practice? So I'm just going to share a few thoughts of what we have a company called as BitCure, which is based out of the United States and India. And we are trying to address and tackle this problem. And it's been challenging because we are swimming against the tide. It's against the norm. And I'll share some of the things that we briefly do. So what it is, we integrate clinical oversight with daily habit architecture. We address insulin resistance, supported by what we call the 4 lifestyle pillars. And we have a system that builds habits into your real life. So if you look at that circle there, the 4 key things that are important are nutrition, movement, stress, and sleep. And the key factor here is language matters. So we try to avoid using the words diet, so we say nutrition. We try using the word exercise, we say activity. It sounds simple, but our brain reacts differently when it hears words which are more comfortable and make sense to us. And then around that is habits, and habits is the key factor which controls everything. And the other side is looking at strength, stretch, stamina, stability, and then of course this side is what we use, a biometric scanner. So these are some of the tools we use. But the key part of this slide is we have a clinician, we have a health coach, we have a movement coach, we have a dietitian. But the key factor of all of this is what we call as the personal accountability liaison. So that's called as the PAL. So every person who joins our program gets assigned an individual PAL who's like a concierge, and they are constantly reminding the member who's joined our program or the patient to keep on track. And when we do it in the US, our back end, actually the PALs are from India, they're psychologists, and all they do is constantly they're reminding, and it's much easier to accept feedback from them than coming from your wife or your family member. So they're just constantly reaching out to you and saying, so Mr. Smith, how was your day? Can we help you? Can we remind you to do some exercise? And that's actually been the kind of the most important factor that has really helped our patients significantly, and that's something that we are very proud of. So that's called the personal accountability liaisons. Then we use objective parameters like the CGM. The CGM is a continuous glucose monitor, and the continuous glucose monitor gives you continuous data, so that data is monitored by a team. So these are all feedback mechanisms. This is just showing a small journey, where patients come in, they get evaluated, and then this is the technology looking at keeping a track of things. So it's all about keeping a track, doing small reminders, small changes, and biofeedback. So this is the key in trying to help people stay on track with their plan, because just teaching somebody, just education by itself is not enough. So some practical wisdom from Grok and Ayu, just to close the circle. Eat when you're hungry. Don't make treats the norm. I think it's important to differentiate between eats and treats. So it's very simple to remember. Move often, celebrate small wins, and find joy in simplicity. So, the focus of this meeting is financial health, physical and mental health. And so I think it's one system, and it's 3 interconnected pillars. So physical health is energy, vitality, mental health is well-being, financial health, I think Vinod already talked about, and the next talk is going to be on mental health. And really, all of these 3 things are intimately interconnected. If one of them fails, the stool gets unstable. So I think it's really important to understand that these 3 things are the core factors which control our lives. So from cure to prevention. So to summarize, chronic disease is predictable, preventable, and costly. We currently operate as disease cure, not healthcare. Physical, mental, and financial health are interdependent. Prevention requires systems and not willpower. Responsibility is shared, individuals, organizations, healthcare, and policy. And that leads me on to the panel, because we've got experts in all these areas today who can share their perspectives. So transformation is intentional, it is human-centered, and it begins with health. Thank you. Can you put the second slide, the slide presentation with the questions on, if you can? There's a presentation. If you can, otherwise it's okay. Yeah, it's on that, but it's not showing on the back, so. Yeah, it's showing on our screen, but not on the back screen. So. Oh yeah, there it is, okay. So let me start by introducing the panelists. So Dr. Nalanda Jayadev is the Chief Executive Officer of Aster MedCity, where he leads strategic growth, operational excellence, and patient-centric innovation across one of India's leading tertiary care hospitals. With over 2 decades of experience in healthcare administration, he previously served as the Chief Operating Officer of Rajagiri Hospital, playing a key role in strengthening their clinical programs and institutional performance. An alumnus of Rajiv Gandhi University of Health Sciences and the Executive Management Program in Healthcare at IIM Kozhikode, Dr. Jayadev brings a rare blend of clinical insight and management expertise to building high-performing, patient-focused healthcare systems. So Dr. Jayadev, welcome to the panel.
Thank you.
Next is Mr. Srivatsan Aparajitan. He's a healthcare leader with over 3 decades of experience, driving innovation and transformation across the healthcare ecosystem. He currently serves as a managing director of Intent Healthcare Technologies, which is a healthcare solutions company which was spun out of Vital Healthcare Services, which is India's largest third-party administrator TPA for health insurance. He has held senior leadership roles with organizations including IBM and Apollo Hospitals. He is an alumnus of IIT Madras and IIM Ahmedabad. He's the co-author of Mission Possible, Paving the Road to Universal Health Coverage, a book that examines systemic healthcare challenges and outlines scalable models for delivering affordable, high-quality care. And he's promised to give me a signed copy after the panel discussion. So he's deeply passionate about preventive health and healthcare financing solutions that reduce avoidable medical expenses. Dr. Bijoy Eratil, he's a senior healthcare leader, trained orthopedic surgeon, and a public health physician with extensive experience in health systems management and policy implementation. He currently serves as a joint director of operations at the State Health Agency, Government of Kerala, where he leads strategic planning, operational coordination, and performance optimization across statewide health programs. As the state program manager with the National Health Mission of Kerala, he has led key initiatives to strengthen the healthcare delivery, improve population health outcomes, and advocate policy reforms. He has played a pivotal role in fostering cross-sector collaboration to enhance equity, efficiency, and access to quality care across the public health landscape. So welcome to all of y'all. So I'm just going to, I think the questions, can you put the first question up, please? From your experience, where do you see the biggest gap today between how we define health and how we actually manage it, especially in India?
First of all, I'd like to thank the KMA for inviting me to be a panelist in today's conference. Thank you, Dr. Gaitonde. And I'd really like to start by saying, who is defining that? You spoke about calling something as disease care versus health care. The question is, who is really defining that? A lot of these definitions are actually coming to us from institutions, but if you take the individual's point of view, the individual really understands it in terms of the impact of whatever is happening in that individual's ability to perform the tasks that he or she would like to do. So there is obviously a huge gap between the way that other stakeholders define it versus how the individual has to do that. And I think that's really where the gap comes in. Would you like to add to that?
Yeah, I agree with you. Defining health is as difficult as defining happiness. So no one is sure what exactly health is. But the more simplistic way of how our people look at is not having to go to a doctor, his health, or it could be as good as doing something which you could do 10, 15 years ago in the same way, in the same spirit, at the same time. So two different definitions which strike me. But again, there is a huge gap. What gap you mentioned is very true. The lifespan gap and the health span. So the gap between these two is huge, and let's see what we can do about it.
Yeah. So Dr. Bijoy, I think you are from the policy hat, and you need to tell us, what is your perspective on this, Yeah,
thank you. First of all, thank you, Kerala Management Association team, for giving me this opportunity. Now going to the question, being a part of the Kerala State Health Services Department for the last 16 years, I would definitely say that the service department defines health as holistic, like physical, mental, and social well-being. But in reality, what is happening in Kerala, you all know. The healthcare management mainly revolves around the doctors, the hospitals, the medicines, and the newer treatment modalities which is being practiced in Kerala. That is, in actual reality, that is what is happening in Kerala. While we sitting in the policy making positions or implementing any newer projects, we consider it as primary or preventive or promotive healthcare system to be implemented. While Kerala decided to implement the Ardhra mission, we primarily focused on the preventive and primary care aspects. So, as you said earlier, if there is no warning signals to show that you are going to be unhealthy, okay, we are not at all bothered about our health. So actually, as part of Ardhra mission, we implemented we set up around 5,416 Janagiya Arogya Kendrams across the state for doing the annual health checkups and all. And we conducted a Shaili survey for that also. So we, with the help of our ASHA workers, we conducted a survey among the entire population, and we set up a benchmark like CBAC score, and whichever is higher than the CBAC score, we reminded them for having been checked for a health checkup. Then also the actual turn-up was around 20 to 30% only among the suspected one. So the actual gap is, which I feel is, we are still roaming, or we consider health as an episodic or a specialist-driven illness cure system, rather than considering it as a day-to-day well-being. There is a real gap which I feel in current healthcare system. Thank you.
No, I think that's a great point about looking at it. And the episodic way we look at it actually is what the system is designed. And I think I was talking to you earlier, I think the system is incentivized towards episodic care. There is no incentive for trying to keep people, healthy, but it's changing. I think it's changing, and as the systems change, I think the mindset and the policy will follow. So let's go to the next question. If you want to move, actually go to the next one, please. Go to the next one. Yeah. So in the Indian healthcare context, what do you think, each of you think, what limits early detection and prevention? Do you think it's awareness? Do you think it's access? Do you think it's incentives? Or do you think it's culture? Because obviously what each of you mentioned, there is a barrier there. So what do you think? Because unless we understand the barriers, then we can start slowly chipping away at them. So what do you think in your experience is what limits us? What is stopping us from?
Can I go first?
Yeah. Go ahead.
So I think it's a multidimensional problem. There is no one easy fix to that. Okay. For instance, there is low awareness. Okay. Now, especially when you think infectious diseases, you think acute care requirements, there is pain which leads you to go visit the doctor. But in the case of non-communicable diseases, very often the manifestation happens much later. So take diabetes, for instance, which receives a disproportionate amount of attention, is that from the time the onset of disease to the actual diagnosis sometimes can take as long as 8 years, which means that somebody could have demonstrated a tendency towards pre-diabetes and now is a full-blown diabetic, but is diagnosed only after 8 years. Okay? Now, who failed that person, or where is the gap? This person probably may have visited a doctor during this period with some other acute conditions, may or may not related to this underlying diabetes. But the physician probably doesn't follow a protocol that is designed to surface the problem earlier. The other aspect is that, let's say, hospitals do a lot of preventive health checkups. You go to a hospital and the hospital is, for instance, in the context of diabetes, is checking for fasting blood sugar and HbA1c, which will show elevated values only when you're a full-blown diabetic. However, if you want to evaluate if a person has tendencies to become diabetic, you should probably be checking other markers. So there is gaps all around. And I think that the way to fix this is really for the individuals to become more aware so that they start taking ownership of this whole process. If you'd like to add.
Yeah, so I feel this is a combination of all four: awareness, access, incentives, and culture. The Indian healthcare is now fragmented care. You don't have that, the family physician concept is almost eroded. So that I think is the root cause. You know, earlier these family physicians used to understand your history well, your requirements well. That holistic approach used to be there. They know when the patient's family is facing or looking at the next wedding or the next childbirth, and they used to advise accordingly. And they were aware of the financial health or the social health of the patient. Now things have changed. It's all fragmented, and this has led to a situation where hospitals like us are incentivized for treating diseases rather than focusing on preventive care. We do provide preventive health checks, but that continuity is difficult to maintain. So that trust, the continuity is very key to this preventive care. That I don't think is possible at the scale that we are catering to. So that's where I think it's a combination of all.
So, Dr. Bijay, I think we were just talking earlier about this, that, Kerala actually is one of the leading states which is revisiting this family medicine. It's one of the first states which is pushing for the family medicine residency training programs. All over, it's the leader in this. And you're absolutely right. We have lost that. Previous times you would all have a family doctor, because this issue which you're talking is not just health, it's social. You're right. I mean, what's happening in the family, or who's available, who's the social support, and that's gone. And today, like I said, if you get a cough and cold, you see a pulmonologist. You have so you don't go and see a primary care. So I think we are not only making it, expensive, but we are losing that whole, the whole system. So that's a very good thought. So, Dr. Bijay, your any thoughts? You're at the kind of the front line, so that's why I'm, pushing it to you, because you're at the front lines of also probably making some changes here,
Actually, the next thing is some of my thoughts. Awareness among the general public in Kerala is very good, I think. Everyone knows about the risk factors and the pros and cons of having some these habits and all. So then also they all are doing the same thing. I already mentioned about the Ardhra mission thing and introducing the testing centers and all. And I feel that there is some culture. We call the health seeking behavior is high in Kerala comparing to other states and all. But the health seeking behavior is for curative purposes only, not for the preventive or promotive aspects. I can see a lot of corporate companies, this thing here. I just have a query whether you can add some incentive provisions for maintaining a better health to your employees. For a government health setup, it is not possible. That's what I'm just checking with you. You are spending lot of money on insurance and for giving treatment to your employees. So is it possible to give any incentives for maintaining a better health, that he can maintain good physique with maintained blood pressure, maintained sugar level and all? If we can do something like that, I think we can achieve more preventive aspect in that.
This leads us to our next question, and I think you are the best persons to answer this about productivity. Can you go on to the next question, please? So, so if you look at this, the question is, besides medical bills, what is the real cost of poor physical health on families, productivity, and mental well-being? And I was just talking to Srivastava earlier about this, and employers play a big role, because remember, if somebody gets sick, a family member gets sick, you're losing productivity. And I think he has done some work in this space, so it'd be great to hear his views on this.
So in the workplace, there is a lot of discussion around absenteeism arising from ill health. But in the work that we did with a large number of really large companies, what we found was this persistent theme around presenteeism, that employees show up to work but are not performing at their best. Now, the underlying set of illnesses, if you may call it that, which cause this presenteeism, could be something involved directly with the employee or with a family member as well. And there are many, many, many such conditions which often the employees kind of suppress because they have to show up to work. But while at work, there is no way that they can produce output. So one of the classic situations is headache, lower back pain. These are all conditions which employees tend to brave and still show up to work. But there is no way that somebody with a bad migraine can produce their A game at work. And this is a recurrent theme right through, and it's important for the employers to understand this, because what research shows is that presenteeism costs 6 times as much as absenteeism. If you'd like to add to that.
Yeah. I'm glad that you started the question with beyond medical bills, because I was expecting most of the people to stare at me when you mentioned that. But that was on the lighter note. But the real cost is definitely, as Srivatsanji said, it's beyond absenteeism. Imagine a pilot not being in the right frame of mind at the right time. It could cost 100 families. Okay, so we really don't know how to estimate this. But again, the bottom line remains the same. Health is wealth. Nitin Kamath, the founder of Zerodha, very famously quoted that in India, most families are one health incident or one hospitalization away from a financial disaster. So that is the bottom line of it. Yeah.
Adding to that, there is one study which showed that around 3.3% of Indian households are thrown into poverty just because of this catastrophic illness management. So I'm just highlighting one Kerala government initiative on that. To prevent that catastrophic expenditure, the steps, it is not covering everything, but then also a small humble start from the state of Kerala, that we are implementing Karunya Arogya Suraksha Paddhati scheme, which is actually covering around 43 lakhs families across Kerala, and two, three other programs also, like Karunya Benevolent Fund and Arogya Kiranam for under 18 schemes for covering this catastrophic health expenditure and all. So the annual expenditure for all these schemes is around 2,000 crores for running these schemes. So every year, the persons utilizing, the individuals utilizing the scheme is growing up. Actually, I personally don't believe that it is a success of our scheme, but we need to reduce the individuals which is utilizing this scheme. So by promoting the preventive and promoting health, that is what we need actually right now.
So I think it's, if you look at a pyramid, at the moment the base of the pyramid is all the acute care people. So unless you make that turn, and over a period of time you start getting them healthier, that pyramid will change. And at the moment you're being overwhelmed by all the, you're not even able to deal with the acute, but it's a process. But other thing I would ask you, you seem to have a lot of initiatives. What is your experience in awareness about these schemes? I'm just, because you seem to mention a lot of them. Is there awareness with, let's say, Dr. Jayadeva's hospital, or, is there a good initiative? I mean, do you have a good, this message, is it being, do you think, distributed well enough that people are actually able to avail of these? I mean, that's a...
Yes, definitely. We are in our 11th year of operations, and a lot of companies, especially the corporates, send their employees to us for their annual health check. Depending on their appetite, we have a host of tests, and they are making their move to keep their employees well. That is already happening. Again, the extent which this screening helps is something we need to look at how to improve this. Recently, we have brought in a host of non-invasive tests which can predict the risk of cancers and such things, the NGS tests and all. So as new modalities of investigations come up, we'll try to incorporate them. And hopefully we will have to, we are aware definitely that we need to focus more on preventive care. That is one thing. Second thing is we are also looking at how to embed preventive lens into our day-to-day assessments. So that is something which is lacking in the current Indian healthcare. If that comes in, if that becomes mandatory, probably it will drive up the cost nominally, but as you said, a lot of this could be saved eventually. Yeah.
So interesting thing, from what I understand, and is that, and I would, because of your experience in the insurance industry, that often insurances don't cover outpatient care here. which to me is that, first of all, is that like the outpatient care often does not get covered, right? Outpatient.
In India, for
In India.
historical reasons,
Correct.
outpatient care is
Correct.
not paid for.
Which to me is actually the I mean, if you're not covering outpatient care, so that's kind of, you're shifting the burden. So probably that's are you seeing this change? Because without that, you're almost forcing people to get admitted for things which you could do, and then the cost goes up, and then I'm sure you have to deal with it when people says, why is this costing so much? And you could have, so I think that's a culture shift and a shift, not culture from the patients, but also from the industry. So what is driving this? I'm just curious. Why do they do this, you know?
So when insurance first became available, health insurance first became available in India in the year 1986, the policies actually covered outpatient care as well. But at that time, the insurance companies did not have mechanisms in place to identify fraud. And therefore, they found that there was very high payouts resulting from misuse of the outpatient benefits in the policy. And so they did what anybody would do in that situation. They removed the benefit. And they have not been able to reinstate that despite the industry having grown. Right now, if they had to reinstate it fully, the cost of buying health insurance would become so much high that the industry is not fully equipped, both in terms of people who can sell that product, that you can get enough people to pay that amount of money to buy policy with comprehensive health benefits. So a lot of insurers do offer some form of outpatient benefits, but medicines, which actually are the biggest cost involved in outpatient care, are excluded from that.
Interesting, because I think that would eventually add a huge, I mean, it's almost like, you know, if you did that over a period of time, you would be able to change the whole paradigm. I mean, you know, that's the whole thing.
Change is happening, but at a very slow pace.
Yeah. So next question, and I'm going to start with Bijoy on this. So who should take the lead in shifting India from cure to prevention? Individuals, employer, healthcare systems, or policymakers, and why? And I think if you can, I think you shared with me that, you know, I think it's interesting that what we are doing looks like you have launched it recently. So it'll be great to hear from you on that. Yeah.
Yes, sir. Yes, sir. For this, actually from the policy makers level, in Kerala, we started a new program which was launched in January 1st, 2026 by our Honorable CM. The program Vibe for Wellness. So when we discussed it today morning, and when we saw the slides here, the four themes which we actually spread is eat well, sleep well, act well, and one more was there. Something for well-being, actually, mental stress. So 4 themes were there. So when we saw the slides shown by Gaitonde sir, the same thing was mentioned there. So from policy level, we actually initiated for the activities for that. So some physical activity in between your hospital time also. Like we did that yoga. Sitting yoga is also there. When if you can't move out from your seat also, if you are working in a corporate sector, you can do something, some physical activity to promote your health actually. So for promoting health, we initiated that thing, program, Vibe for Wellness. I hope everybody will participate in that. So that is what we are expecting now. Though we started from the policymakers level, we initiated that process. Now everyone else to take part in that activity. I think the major hospitals will also know about it, and they started working on it also. Thank you.
Yeah, we have started that 10 years back. Our brand promise is we'll treat you well.
Having worked extensively with large employer organizations, I am of the view that the employer actually has the most to gain by promoting good health, helping employees to follow a preventative approach as opposed to. However, the challenge even when employers put their best foot forward, is how do you motivate the employee to participate? Very often, there is a very high level of distrust. So, for instance, when we used to run these programs with employers, I would always request the senior leadership to come there and be very upfront, saying none of the data that came out of any of those activities the company would have access to. As a service provider, we were very careful. If somebody from HR said, "Can you share data?" we would say no. Because for an employee to have a fear that his health information is now available to the HR and how that could possibly affect his promotion is a big deterrent. So that still needs to be fixed. But there are ways to fix it, but I think that the employer actually has the most to gain and therefore should drive that whole effort.
So last questions. Hope all of you are listening. I think the ball is being tossed back into your court. But I know I agree. I completely agree with you. I think this has got to be a partnership. And it's the productivity loss. That's the intangible loss. And the presentism that you talked about, that's huge. Because people come for work, but they're not at work. So the last question, if you just go to the next slide. So if you had a magic wand and you could change one thing today, to move towards prevention, focused health, what would it be? Dr. Jaydev, why don't you take it this time? So you are the bearer of the largest healthcare, one of the largest healthcare systems. So you had a magic wand, what would it be?
See, at my center, most of these high-end procedures and interventions which we do for conditions other than unnatural events like a road traffic accident, if you look back, the previous 1,000 days, they could have been picked up. All these high-end procedures I am doing today, at least a majority of them could be picked up within the previous 1,000 days. So let us make it a point to undergo extensive preventive checkup in at least once in 1,000 days. You can definitely bring down the cost and improve your contribution, productivity or contribution to the society. So let us begin today, begin from ourselves. That is the message I want to give.
That's excellent. Dr. Vijay?
As per my concept, just promote the physical activity. Like in the previous speech, as Miran sir said, promote some physical activity like football, anything. Because to move our children from mobile-based games to playground games. So that will give us a better, healthy India tomorrow. Thank you.
Thank you.
If I had a magic wand, I would just rid the world of diabetes.
Okay, so thank you very much. This was very enlightening, and I think this is amazing to hear all your perspectives. And I learned a lot. I think it's amazing, and made some great friends here. So thank you very much.
Indeed.
Thank you, Dr. Gatondi.
Indeed, such an enlightening panel discussion. We'd like to really say thank you to our keynotes. Gentlemen, can I request to please have you up on stage for a little while longer? We'd really like to say thank you to Dr. Krishnanath Gaitonde for both your keynote speech as well as your moderation in this panel. We'd like to say thank you to Dr. Bijoy Iratil, Joint Director Operation, State Health Agency, Kerala. Mr. Srivatsan Aparajitan, Managing Director at Intent Health Technologies, and of course, Dr. Nalanda Jaydev, CEO, Aster Medicity, Kochi. Can I please have up on stage our President of Kerala Management Association, Mr. K. Harikumar, along with Senior Vice President and Convention Chair, Algiers Khalid. Please come by.
afternoon all. Now we are moving into the plenary session 10, emotional well-being. Distinguished guests, ladies and gentlemen, it is a true honor to stand before you today in this auspicious event. We are gathered to celebrate health, innovation, and the dedication of those who safeguard our community's well-being. As the famous quote by Virgil goes, the greatest wealth is health. And today, we have the privilege of being joined by a gentleman who has spent his entire career protecting the very wealth for women and families. It's my distinct pleasure to introduce Dr. Nagesh Konekar, a highly decorated obstetrician, gynecologist, and fertility specialist. Dr. Gonekar's journey is one of consistent excellence. Back in 1997, he was a university gold medalist for his MD, and his pursuit of knowledge has since taken him across the globe, from completing specialist trainings at the renowned Women and Children's Hospital in Adelaide to a prestigious fellowship at Thomas Jefferson University in Philadelphia. He has always sought the highest standards of medical science. In the medical field, Dr. Gonekar is recognized for his comprehensive clinical triad of expertise. He possesses deep expertise in fertility and IVF, helping families overcome both male and female infertility factors. He is also a specialist in minimally invasive surgery utilizing laparoscopy, keyhole procedures to significantly reduce recovery times for his patient. Finally, he holds advanced credential in ultrasonography, including a diploma in diagnostic ultrasound, which allows for precise in-house diagnostic accuracy. Beyond his clinical skill, Dr. Gonekar is a distinguished leader and mentor who has served as the chair of the Women's and Babies Committee at Mater Hospital, Mackay. While his credentials are vast, his true impact is felt through his compassionate bedside manner and his unique gift for translating complex medical jargon into clear, accessible language for his patients. He is a firm believer that 21st century healthcare should be a collaborative journey, a true doctor-patient partnership built on the pillars of mutual trust and evidence-based medicine. In the word of William Osler, the good physicians treat the disease. The great physicians treat the patients who has the disease. Dr. Gonekar embodies this philosophy by ensuring that every woman he treats is an active, informed partner in her own health journey. He combines world-class innovation with a deep personal commitment to individualized care. Please join me in welcoming the leader and educator and a dedicated advocate for our community, Dr. Nagesh Konekar.
Put your hands together, ladies and gentlemen. Thank you, Dr. Anil Joseph. Over to you.
Thank you very much.
Dr. Nagesh Gaunekar.
Thank you. Thank you very much. That was too kind of introduction. I must say it's lovely to be in God's own country, Kerala, very close to my heart. I love to come to Kerala often. And I've received affection from all parts, including a Kerala virus that has taken particular affection to my throat. So mind my little moral support in this bottle. So today we're going to talk about emotional health. And I think this audience will be forgiven to think, why is an obstetrician and a gynecologist talking about emotional health? Well, when I joined this craft, this specialty, where can I have the previous slides? So I'll just go back. Yeah, so just in brief, I deliver babies, I do IVF, I do fertility treatment, and these are all organizations that I'm associated with. The reason, to give you the background, that 30 years ago when I joined this profession, I thought that is what I would be doing. But far from it, soon I realized that emotional health is not just an optional extra, but it is a centerpiece of medicine in general and obstetrics, gynecology, and fertility medicine in particular. So to answer this question, why is an OBGYN talking about emotional health, let me take you through a couple of real-life examples. This is Anna on the right. She's a patient of mine who's been trying to have a baby for 4 years. She has a colleague and who is also a friend. Who comes to the office and announces that she's pregnant. Now, Anna does all the right things. She congratulates Haley, she hugs her, she smiles, but she goes home and spends a couple of hours crying. And what she said to me left an impression. She said she was not crying because she was sad, but she was crying because she could not feel happy for Haley. An example more closer to this part of the world. This is Amit and Maya. These are two tech workers. And as modern life has taken a toll, got married in mid-30s. What you see is the family pressures. 12 months through their marriage, there's an unwritten, unspoken expectation from what appears to be a supportive family, the extended family, the mother-in-law, of a grandchild. And when it doesn't happen, there's a lot going on in the back of the mind. So the complexity of these feelings that are creating havoc in the mind, that guilt, that unspoken grief, that constant self-judgment, that's stress physiology. That is cortisol, the hormone that drives stress. That's poor sleep, that's strained relationships. And over time, that emotional load becomes biological. So this is the modern proverbial monkey on the back that we are carrying, and the load is getting only heavier. We've got stress, we've got anxiety, we've got depression, and relationships that are under strain. So how do we get this monkey off our back? That's the topic for today. So you would have seen this three-legged bar stool theory, and I must thank my friend Vinod Taragan. He's been instrumental in popularizing this bar stool theory that we have been talking about for a while now. But it creates a simple framework. But simple is never easy. A simple framework where the bar stools has 3 legs. The first leg is of physical health. The second leg is of mental health. And the third of financial health. Now, it is important to understand the relationship between the 3 legs. Now, each of the legs is independent in its pursuit. For example, just because you're financially healthy doesn't make you physically healthy. Just because you are physically strong doesn't make you mentally healthy. So you have to pursue each of these legs, each of these pillars independently. But they are interdependent in their survival. What you often see, if one of the legs falls short, the bar stool on which the platform of your life and the path to fulfillment rests starts becoming wobbly. And if one collapses, all 3 collapse. So that's the relationship we need to understand, embrace, and take forward to make our lives much more fulfilled. So I will cover today the what, the why, and the how of emotional health in the next 18 minutes. So what? What is the cost of modern day living as far as mental health is concerned? That's the main focus of today's talk. We live in a new world, and this question should haunt all of us. Now, the whys. Human race is the only race that asks this question, why? And as far as mental health is concerned, these are the whys that I would like to put out there. Is that why is it, if life is materially better, so many people are feeling mentally worse off? Why are we more connected than ever before, yet more lonely? Why does comparison hurt more in an age of abundance? And why do people with everything seemingly right still feel something is missing? So to address these whys, we will dwell a little bit deeper and then look at how. How can we address this mental health crisis that is assuming epidemic proportions? Just like Dr. Krish Gaitonde gave you an example of the metabolic syndrome being an epidemic, this is a silent epidemic as well, and one that is taboo in a lot of our society. And how do we solve loneliness, anxiety, and despair with the same speed that we solved hunger, shelter, and disease? That's the question for today's conversation. Let me introduce you to the DSM. For the uninitiated, this is the Bible of mental health disorders. It labels or gives definitions for several disorders, and then its relationship with pharma. This is the data point. If you look at 1952, the first DSM came out. It had 130 pages and 106 disorders. With every revised edition, you see the number of pages and the approximate diagnosis increases to now, in 2022, there are over 1,000 pages, and at last count, over 540 diagnoses. So what does it tell us? Are we getting more disorderly? Are we getting more sick mentally? What is going on? When it comes to pharma, I call them the dubious duo. Whenever there is a disorder, pharma provides a pill that can fix it and creates an unrealistic expectation. It takes out the individual from the responsibility to try and help healing. The fact is that antidepressants are not the magic bullet that we expect them to be. They have their place, they have measurable benefits, but they last for only up to 12 weeks, sometimes 14 weeks, but not beyond. Beyond that, an average person finds symptom improvement plateaus. And long-term use, which is very common in today's society, it offers diminishing returns for many. It's generally driven by withdrawal or avoidance rather than ongoing benefit. Social, psychological, and meaning-based drivers of distress are under-addressed. And is that because of this dubious duo is the question I'm proposing here. James Davis, who's a psychotherapist, an anthropologist, and the author of a landmark book called Cracked, opens this, and he makes certain observations that are quite thought-provoking. He does not claim that medication is not helpful. In fact, medication can be helpful, sometimes even life-saving, particularly when the distress is acute. But evidence suggests that for many people, its benefits plateau, as we saw in the previous slide, highlighting the need to address emotional well-being, meaning, relationships, sleep, stress, and purpose alongside with medication. So there is no silver bullet. It's very important to understand this diagram, which shows that the tip of the iceberg, which we see, is the mental illness that we see in society. But below that tip of the iceberg is a large body of emotional stress, which is left unaddressed, and that provides the engine room to drive us to mental health disease. So let's ask why. Why is there so much emotional stress? And this goes to the first principle that my friend Vinod Taragan this morning talked about, the basic needs of human beings that was documented by the psychologist Abraham Maslow in the middle of last century. And these unmet needs, are they the driving force for mental health disorders? We have physiological needs that level 1, we all need them: air, food, water, shelter, sleep. And I think we are past that. Safety, all of us need a sense of security, a sense of health. Level 3 is a big one: love and belonging. Are we chipping away at this with fragmented families, with relationships that are more transactional? Is that a victim of modern day living? The level 4 is a trap. It's a level that looks at self-esteem, status, recognition, ego, pride, jealousy, envy, greed. All these are esteem issues that be a trap, and we can often get trapped in it by running a race that we can never win. Just like Vinod talked this morning, he said we could buy a car just to have a better one than my neighbor or friend. That happiness lasts for 2 weeks. After the 2 weeks, it's again a sense of emptiness. And is that another reason that's driving mental health issues that are bubbling up in society today? And level 5 is self-actualization. Self-actualization is being the best version you potentially could be. So that is an area that is to be explored by the individual. And to understand that we have an opportunity to do that in this lifetime is a privilege. And we can do that on a spiritual journey, a cognitive journey, a journey of self-awareness, and an appreciation of aesthetics around us. So, ladies and gentlemen, what I'm proposing to you is this is the paradigm as it exists today. Disease and distress at the very bottom, and a state of neutrality, which is the absence of disease and distress, that is defined as health. But is it so? And I say, let's change that paradigm. Let's not say that if we don't have disease, we are healthy. Let's say we have to be thriving and flourishing, becoming the best version of ourselves. That's the state of health that we want to be truly in. That's the state where we will not be selling ourselves short. Let me point to the 2 primary colors of negative emotions. I call it ego and jealousy. There are a lot of negative emotions, but these are the prime colors of negative emotions. Why are they so? Because you cannot bring anything positive out of them. And once we recognize it, we have a chance to address it. Should we address it in education? We again talk about the popular theme that we have been talking about here, is that lots of these things apply to a large population, yet are not taught to us in school, in life, and we just stumble through them most of the time suboptimally. So Charlie Munger, a very thought-provoking man, he gave this wonderful quote that there is nothing more counterproductive than envy. Someone in the world will always be better than you. Of all the sins, envy is easily the worst because you can't even have any fun with it. It's a total net loss. As a gynecologist, I could not exclude the play of hormones. This is central to our craft as well. There are endorphins, there's dopamine, there's serotonin, oxytocin, and cortisol. Now, hormones are substances that are released by organs in our body that impact our moods, our emotions. So, to understand what each hormone does, endorphins are short-lasting, but they're helpful in acute coping. Endorphins are often released when we exercise, so you feel good after an exercise session. Dopamine drives motivation, it drives progress, it drives purpose, it drives action. Serotonin is the calm, the emotional calm that we need to function. It provides mood regulation. Oxytocin is the love hormone. It gives us connection, it gives us belonging, it gives us trust. And cortisol is the survival hormone, the stress hormone, and it tends to dysregulate our mood. So, to remember them in a nice way, think of endorphins as the fire extinguisher. They are needed when there is an acute problem. Dopamine is the engine that keeps you going. Serotonin is the foundation that keeps you calm. Oxytocin is the glue that binds everything together, and cortisol is the alarm system. Now remember, if the alarm system goes into overdrive, what do you get? You get stress, which is a state of mind. It disrupts your sleep, it impairs your mood, it suppresses other positive hormones such as serotonin and dopamine, and it increases anxiety and depressive symptoms. Reducing cortisol requires boundaries, recovery, mindfulness, and meaningful rest, not just mere inactivity, not just laziness. So it's also important for us to understand the relationship between the rational and the emotional brain. The emotional brain predates the rational brain. So it's also called the reptilian brain. So as we evolved, we were designed for survival, not for happiness. So the limbic system, or the reptilian brain, is fast and intuitive. It relies on feelings and instincts, but it does not provide any dividends beyond survival. The rational brain comes from the prefrontal cortex, which evolved later. Now this is the strength of human race. It is slow, but it's logical. It is a reason. It responds to reason, and it is involved in planning, in strategizing, and making real progress that we see today. The interesting relationship between these two parts of the brain is that when the emotional brain is overactive, the rational brain freezes. It refuses to show up. So a performer, for example, a cricketer, will not perform at his best if he's nervous and he tends to edge the ball to the slips. So that is important to realize, that calming the emotional brain is the first step to letting the rational brain show up and show what it's got. In my world, I often get asked this question: can stress cause infertility? When couple comes to see me, they often think they're stressed and that's therefore causing infertility problems. But it is not that simple. It is a complex problem that stress can contribute to infertility, but infertility also contributes to the stress. It's a vicious cycle. It affects the quality of life. And that, again, is another compounding machine that keeps going round and round in circles. If you do not address this emotional health, there is no way any fertility treatment is going to help. I'm proud to say that I had the lab that received the highest position on the leaderboard for results as far as IVF is concerned in Australia for last year. Now, my colleagues often ask me what we are doing differently in our clinic. Are there different protocols, different treatments that we offer? And I say the simple answer is no. And I really feel we addressing emotional health as a primary focus before even embarking on fertility treatment is the key to this statistic. We talk about 5 mantras of happiness, as this is addressing the hows. There are the 5 mantras, which is simply engaging with people, elevates your mood. It brings into focus relationship and collaborations. Investing in experiences enrich you much more than materialistic stuff. Living in the present moment with mindfulness is a big step. And the big one, this is gratitude. Gratitude for the past is very important. You often see this in prayers. People that find power of prayer, it's the sense of gratitude that it brings on that gives you this dividend. And pursuing a purpose that's bigger than ourselves for the future. So mindfulness for the present, gratitude for the past, purpose for the future. That's the engine room of happiness. The longest running longitudinal Harvard study, this is objective evidence. Now, when I talk about evidence, give you a little snippet about what is evidence-based medicine. We don't rely on opinions, not because I'm an expert, but we rely on data. So this is an amazing study. They looked at all their alumni since 1938. And what it showed, at the level of happiness, the 3 big predictors of a good life were strong relationships, ability to regulate emotions, and purpose and meaning. And the 4th one, even more important, that these 3 outweighed genetics, childhood adversity, or career success. So it's important to realize the top 3 are totally in our hands. The bottom 3, they are, you can say, God-given, nature-given, or has happened serendipitously. So very important to realize that our destiny is in our own hands. One more interesting data point I want to give you was this beautiful research done by Bronnie Ware. She was a cancer nurse in Brisbane, and she wrote this book as Regrets of the Dying. So when there is finality, what do we regret? The regrets the dying were having was that I wish I had the courage to live a life that is true to myself, not the life others expected of me. I wish I hadn't worked so hard. I wish I had the courage to express my feelings. I wish I had stayed in touch with my friends. And I wish I had let myself be happier. So it's all things that are, again, truly in our hands if we are mindful, aware, and intentional in our living. I'll leave you the last 2 slides as the cycle of life. And because this is a management conference, I think people can relate to this. is that we are born, we learn, we earn, then we retire, and then we die. And these are the triangles we generally are negotiating. When in our early days, we have, if you see the sides of the triangle, they represent time, health, and money. So we have time and health in the early days, we are short of money. As we go through the earning cycle, we have money, we have health, but we don't have time. And then we retire, where we have time, we have the money, but we fall short on the health. But the magic happens here. There is an equilateral triangle, a triangle of balance that you can carve out, where the time, money, and health, you can extend this with intentional living. And if we aim to do this game of triangles, we could win and we could make purposeful steps towards a very fulfilled life. With that, I would like to introduce the panel, which is a very distinguished one, and I'm very excited and anticipating a very good discussion here. Yes, Jeffrey.
Of course,
Thank you.
we'd like to have a round of applause for the wonderful Dr. Nagesh Gaunikar. Of course, from keynote speaker to now moderator.
Yep. Thank you. Now, this is good. So first of all, let me introduce this elite panel. I must say, if you wanted a variety, this is where it is. Every person on this panel is an entrepreneur, a founder, and comes with a very good pedigree. Let me introduce first Dr. Jyoti. Dr. S. Jyoti Nirja, she has a resume that can cover the entire panel discussion, so I'm going to pick a few snippets. She is my colleague as far as the craft goes. She's an obstetrician and gynecologist by training. She's the MD and CEO, healthcare and entrepreneur, and founder of People Tree Hospitals and Marga Mind Care. She has 3 decades of experience spanning clinical practice, hospital administration, and healthcare innovation. She began as an obstetrician gynecologist before making the bold choice to step away from practice to build institution with a wider impact, from transforming a small birthing center into a super specialty hospital to founding and scaling People Tree Hospitals in Bangalore. She's also the founder and managing director of a very exciting organization called Marga Mind Care, India's first dedicated chain of psychiatry and mental health centers. This is a mission that's very close to her heart. And her current vision is to expand this to 30+ hospitals in India and beyond. I'm going to share something about Jyoti, that when away from the boardroom, she's an avid reader, a passionate cook, and a believer in discipline and balance. She begins her day with spiritual music and quiet time in the garden, followed by a signature power dressing persona, most often in elegant silk saris. So I think that's something that we really will find interesting. Enriching curiosity with conversations around travel, books, fitness, and wellness remains the anchor of her life. Now, we might think that that's secondary to our careers, but it's not. This idea of emotional health is all but that. Then we have Sheena Singh. She wears so many hats that she's a founder of Chisel Minds. She's a certified international trainer. She's a certified emotional well-being life coach. She has certified behavioral skills trainer. She's a spiritual healer and a clinical hypnotist and a psychology counselor. So she's all in one, entrepreneur, and she's going to be start a retreat, I think tomorrow, in Alleppey. Is that right? And then we have Ibrahim Hawaz, another co-founder of an organization in mental health. He's the CEO of OPAM, Kerala's first 24/7 online mental health program, an engineer who's turned into a social entrepreneur. He works at the intersection of technology and mental well-being with a clear focus of making mental health support accessible, affordable, and barrier-free. OPAM is a funded startup that has facilitated over 25,000 therapy sessions through a network of 40+ therapists and clients serving 40+ countries. So truly multinational, Hawaz is deeply involved in building systems that scale care without losing the human core of therapy while continuously learning from real psychological challenges people face every day. So starting the panel discussion, I think I'm going to go a little differently to previous ones. I might address one question to one panelist. Let's start with Ibrahim. Let's ask him that he comes from an engineering background. What makes mental health attractive and what makes that your mission, Ibrahim?
Hi. Oh, okay. First of all, I feel like I'm the odd one out here in between all these experts. So I'm glad that I'm here between you people, and thanks KMA for the opportunity. So yeah, like you said, I come from an engineering background and I'm into a mental health platform right now. Co-founded a mental health platform with my friends 2 years back. So the primary reason I started this is because in India, especially in Kerala, we all thought that mental health or emotional well-being is a problem of awareness. But when we started, when the ground reality hit, when I was someone who was aware of it, I was someone who was ready to seek that help. But when I went to seek that help, that's when I realized there is no access. Okay, there is a bigger problem than awareness, which is access to mental well-being or emotional well-being. So that's when we thought of starting something called a mental health platform called OPUM, where we primarily try to solve for access than awareness. Okay. And I would say, I would actually feel like that's the same with everybody here. You know, if I ask somebody, where do you go when you have like your legs broken? You would say that you'll go to this hospital, to this doctor. Even I'll say that I'll go to Dr. Malya, who is the ortho surgeon in our place. But when I go emotionally down or when I am mentally down, can somebody answer where would you go? You don't know where to go. That's the first thing, right? So you are ready to go, but you don't know where to go. You don't know which therapist to go. You don't know the difference between a psychologist or a psychiatrist. So basically, the problem there is, the awareness part, there is a problem. I do agree with that. But beyond that, everybody is trying to solve for awareness and nobody is trying to solve for access. So that's what that's a primary reason why I am into this, why I co-founded something called OPUM. Yeah, that's it.
That's very interesting. I think that's great to hear the nitty-gritties of what real ground level difficulties are when it comes to accessing mental health. It's not just an awareness issue, but it again comes down to education. Do we have the tools? I'll ask Jyoti to give us her perspective from the lens of the work she's doing and what's got her into mental health. Not working. Oh, yeah, you want this? Yeah.
Good evening. First of all, thank you KMA and thank you ClaySys for inviting me here to Kochi, such a beautiful town and a beautiful place. I was more excited when I saw the theme for this year, integrating financial health, physical health and mental health. That's something which I truly, truly believe and I just want to stress that all the more here. That's why I'm here today. Thank you. So, yeah, Mr. Ibrahim gave a different perspective. As a thought leader, I keep talking about mental awareness. I want to spread mental awareness a lot. But having said that, it's very true. There's a lot of gap. There is a lot of, shortage of accessibility as well. So that's why we are here at Marga Mindcare in Bangalore. Dr. Nagesh, I'm an obstetrician and gynecologist, and I keep getting these questions all the time, asking what am I, my obstetrician and gynecologist talking on the platform of mental health. And I also, the psychiatrists come and thank God you're a gynecologist and not a psychiatrist, because I'm not a competitor to them. That's on the lighter note. So being a doctor, not only as a doctor, it's always been very intriguing to me what exactly a patient with a mental kind of an illness or a disorder is undergoing inside. Even before I was a doctor. And although I'm a doctor, I'm a gynecologist, still that is a big question mark for me. You know, when a patient, when a person is suffering through some amount of physical problems, could be pain, could be something to do with heart disease, could be a tumor. We know what the pain is in a grade of 1 to 10, and then we know something called as mild, moderate, severe. You can explain, you can define, but it's always been a big question mark within me. What exactly is the trauma and the suffering a person undergoes when they're having some amount of, mental disturbance? That was something which, how this became very close to me. And when we started People Tree Hospitals, that is in the year 2013, I've always felt this big gap. The gap that we are having standalone hospitals for women and child, we have standalone hospitals for the cancer, we have standalone hospitals for heart diseases, neuro, ortho. But then, why isn't that nobody are talking about mental health? It's always been a neglected and ignored part. Of course, I'm very happy. It's heartening. Nowadays, it's really picking up. There's lots of dialogue and lots of conversations happening around mental health. But still, the gap is huge. The gap is, in India at least, it is the mental health gap is more than 75%. 75% is in the urban areas. But then you go to the smaller towns and the rural areas, it's more than 90 to 92% is the gap. So the gap is both awareness as well as accessibility.
Sure. No, that's a fantastic answer, and good to throw some light on the ground situation of where, as far as mental health is concerned in India. Let me bring Sheena in. You want to share a little bit of your background, what you see in mental health. And since Jyoti brought this question of why is an obstetrician doing this, why is we are working in silos, and we talked about this in our conversation before, would you like to throw some light on identity we carry and what is the emotional burden that that identity gives us? So there are two questions in that.
Hi, good evening, everybody. This is Sheena Singh, and I really, really appreciate that you all are giving your ears to us. While we understand in our daily routine, a mundane life, we have a lot of things to cater to. However, I just want your attention for next 15 minutes or 20 minutes probably, because whatever we are discussing will be, can be a game changer for you. Now, having heard from Ibrahim, having heard from Dr. Nagesh, and having heard from Dr. Jyoti, I have a little different take here. Now, again, as I just mentioned the letter I, I personally do not identify with this letter. Why? I'll give you definite reasons. The prime factor that's bothering our mental well-being and our emotions is because what are the kind of thoughts we are carrying every moment, every time. Now, if I have to just ask you all, are you all there with me right now? Can you all raise your hand if you're all present here in this room? Anybody who's on a mental travel, what I'm going to do for next 20 minutes, after 30 minutes? Anybody? Are you all there? Can you all raise your hand? Yes. The whole game is of having that awareness of the moment. Because the chatter has multiplied the feeling, the environment that we all are living in is so engrossed in certain situations and certain things that we have forgotten why are we even sitting here? Why are we even living? So from the spiritual aspect, and by spirituality I do not say that you do dhyan for the whole day. What I'm trying to bring your focus back on is, and that is why I've introduced the concept of the Soul Awakening Retreat, which is starting tomorrow in Kerala. But why we brought this as a platform where people step out of their zones, really understand that whatever they identify with, is that giving them happiness? Or does that only gives you happiness? So the whole concept of emotional well-being is, what are the thoughts I'm carrying every moment in time? What am I doing? Because every thought creates an emotion. Like if I say, oh, I have to finish this deadline by this time, and you're not meeting that, it is definitely creating a sense of fear, right? So we bring in a lot of modalities like healing modalities like somatic healing. Soma means your body, somatic means your body. And you carry emotions in your body with like a chronic pain in your shoulder or in your back. The whole concept to bring you here at this platform is that we are all interconnected with each other on an energy level. So to have a greater energy, have a greater thought about yourself first, because emotional well-being starts with you, and that moves on to the second person. So this is what I take as the journey.
Fantastic, Sheena. I think that that you said we have to leave it outside the door is the level 4, where the esteem comes in. We identify with the identity and we hold to it, and then accountability that creates an emotional gap that doesn't get fulfilled. And from that to come to me and start feeling a bit better, more grounded. That's a great thought. Can I get Ibrahim in to just highlight why most people seek emotional support as only when they're at breaking point, and can we move towards early intervention to change the paradigm here from truly promoting health rather than addressing disease?
Well, here at this case, I felt like when you have a physical issue, when you have a physical illness, that's more visible, I guess, right? When you have you have a cold today, you might be thinking that, okay, I'm going to get a fever maybe in the next 2-3 days. So that's always there in physical kind of illness, right? But when it comes to mental health, the problem is it's not visible. So we always try to postpone it. Okay, it's just a feeling. Okay, so maybe the thought would be like, it's my problem, or maybe it's like, no, I will feel like, okay, I'm not feeling good, but that's because I'm thinking that way. So the problem here is something that we are not ready to spend time, or we are not ready to actually act on something that is invisible. So that's the major reason why people are, even in my own case, I went, or I tried to seek help at the highest point. Only when it reached that point, that's when I realized, okay, now this is the time. If I don't seek any help, no, I'll be out. So, but the thing is, it was always there. The journey was always to that point, but I did not realize that I was going to that point. So the awareness part again is one thing. And I would say the first thing that you could notice, the things that we were doing in an interesting way, it will seem like it doesn't excite us anymore. So that's the kind of start that I had. My sleep was in trouble. So these are the early kind of things that happens when you're going to a high breaking point. And I think their doctor can add a lot. So prioritizing mental health, I would say even on the peak point, people are not going into therapy. So how do we expect a crowd that is not going to seek help at that peak point to go for help in a preventive way? So we need to solve it, backwards, I guess.
Sure.
Yeah.
Sure. Thanks for sharing that personal insight which is very, very relevant, and we don't need to wait for that breaking point to seek intervention. I might pick Jyoti's brains for her entrepreneurial skills. Like India carries one of the largest untreated burden of mental health. Untreated burden of mental health disease. Yet funding innovation remains limited. As an entrepreneur, where do you see the biggest white spaces? Is it in care delivery? Is it in access? Is it in financiers? Or is it in the culture?
I would say it is in all the four. It is accessibility, awareness, culture, to a certain extent affordability. I heard Dr. Gaitonde speak about so much about the importance of preventive health, but how much are we doing, preventive transformation on mental health front? So, and I think that is equally important when we are talking about equally important. I mean, all these three are not independent of each other, right? The financial health, the physical health, and the mental health. When all these are supposed to be integrated and they are all interconnected for a sustainable future, I think mental health also has to be dealt with at a very, very early stage. There are, I'm sure doctor you would be able to say there are all these diagnostic tools which is now very much available for, diagnosis and early picking up of early symptoms in mental health. I agree there are not big diagnostic, like we have the MRIs and the CT scans and all the blood investigations, but definitely they are very good diagnostic tools. But then the key is for you to, seek help at the early stage if required. Otherwise, like you said, having, loss of sleep and then bringing down the productivity and not able to cope up with the work and then failure of relationship, it affects everything. It affects the family life, it affects the workplace, your working capability and capacity at the workplace, and definitely brings down the productivity. And it affects the financial health of the individual as well as of the organization, and hence the country. So I strongly believe that there has to be some amount of preventative or an early, approach to mental health as well, and before it ends in a disaster. And we have seen mental health problems ending in catastrophes and real disasters, and that can really be very bad and serious. So that culture has to be brought in.
Yep.
And this can be done. I'm sure there are lots of corporates here and the CXOs and the leaders and entrepreneurs here, but this has to be a way of living and a way of working in every organization. If we can all bring this about, then that can become a game changer.
Absolutely. And preventative care is where this whole thing is all about.
Can I just add one more point
please,
here?
Please do.
The affordability part that she mentioned a bit, I think that gives a huge lot barrier here. When you consider mental health, a session that costs around, a normal session that starts from 1,000 or 2,000 rupees a session, and it goes up to like 15,000 an hour, like how many people can afford it? So even that's the case for post mental trauma treatment, right? So when you have barrier for even taking therapy after having a mental disorder, how would you expect the crowd or the general public to have preventive health care, which is much higher? I mean, when cost wise it goes higher than the normal therapy session. So that can't be expected out of the kind of charge that we do right now. So affordability, I would say, would really play a very big part, or else it's like we are serving the elite 1% crowd every time.
Sure. Since you are the engineer in the room, I'm going to throw you a curly one. Do you see AI replacing therapists?
That's a big one. Even if I tell you that it won't, people have already started using it as a therapist. So that's the reality. So there was a post I saw somewhere in Instagram, a reel, that was calling out ChatGPT for being therapist. So in that, every comment that I read was in support of ChatGPT. The people who have taken therapy through ChatGPT. So those are the validation for them, right? So I don't support it, okay? I don't support it at all. The clinical validation as ChatGPT is not yet ready for that clinical kind of validation. But the cost factor again, there is something that is very free out of cost, no single, you don't have to spend a single rupee over there. And there is something else which costs you like around 2,000, 3,000 rupees a session. So people would always try this out. And if they get that kind of benefit, the kind of validation that they seek, surely they'll continue doing it, right?
Yep, watch this space. Let me take this to Sheena. She's talking about preventative. I said, do you want to share some simple daily practices that one can do to improve emotional health so that we don't get to the crisis point?
All right, so here I would just firstly put a demarcation in certain ways, because we are talking about mental well-being, we are talking about emotional well-being. I would really request each one of you to treat it as something to be treated timely. Secondly, there might be moments, and as a psychology counselor, I understand that there are severity, so you should always be consulting a professional, especially when it comes to your mental well-being, because that is under the carpet, but it's playing a vital role. It is said that 95% of your diseases that you see in a physical form, they are created from your mind. That is the power of your mind. Now it's up to you where you want to take your mind's energy, right? So coming back to the practices that I just shared, yes, these practices can be so well supportive in our journey. And as saying, adding on to the point of Ibrahim, that yes, today it is pretty cost heavy, right? Again, that boils down that how serious are we towards taking the sessions as well. Because there is also an underlying mentality, until I pay, I don't pay a heed to it, right? So I am nowhere defending this, but it's the mentality that's bridging. So again, that is another kind of gap we have to work on and understand the mentality. Now, giving simple practices, it is pretty much said that wherever your thought goes, the energy flows. Do you agree on this with me? Wherever your thought goes, the energy flow. Now, a quick example of this is, let's say you think about a favorite dish of yours. What does it make you feel? Or you think about a favorite person. What does it make you feel? How does it make you feel? Can anyone answer? Does it make us feel good? If yes, you can raise a hand. A good food, anything, anything that is good for you will bring that feeling to you, right? So thought creates emotion. Emotion creates the feeling. That's a simple concept we have. Now, coming back to your point, Dr. Nagesh, that what can I do every day to really work around my emotional well-being? The first is that I focus on what am I thinking throughout the day. Now, this is again a conscious line that I'm telling, a logical line that, okay, focus on your thought, right? There is a thing above that we call as energy healing. Now, energy healing says that because your thought is creating an emotion, your emotion is creating some problem in your body, why not, by doing such healing practices, I erase this negative loop of thought naturally. A simple exercise you all can do with me right away. Why not you just make a V like this? Can you all make a V like this? V stands for victory as well, guys. Do you agree? Let's make a V like this and just start rubbing your ear from here. Start rubbing your ear. Right? And you do it one side for like 4 or 5 minutes. You do the other side for 4 or 5 minutes. You will see your nervous system calming down naturally. All of us are living in psychological fear every day. And as you rub, as you do a gentle rub, this is one of the somatic healing exercise I'm telling you. And this exercise is not yoga. This exercise is not, we are going for a walk or something. I'm just telling you, before your board meeting, before your presentation, if you can just do a few exercises of somatic healing, that calms down your nervous system. All of us have become habitual of living in a sympathetic mode, which is fight or, fright or freeze mode, right? Coming to the stage, presenting, talking to somebody about something very important. All of this has started giving us internal fear, internal anxiety. Now, when you are doing somatic healing, and there are many more, I can't keep talking considering the panel discussion here. One of the things that you will see that your nervous system is calming down. You are stepping into a parasympathetic mode from sympathetic mode, which tells you that your body is safe. If you just want to check with yourself, how safe do you feel every day or throughout the day? Your body will answer a lot. And whatever chronic pain we are carrying is an outcome of your emotional processing, how you are processing yourself emotionally. We may be great stakeholders in companies, but am I processing my emotion in simple terms? I may not need an expert there, that is secondary, to answer that how affordability can be treated. But trust me, go and online, have a somatic session, learn a few exercises. You will see your anger coming down, you will see your fear coming down, you will see your depression levels coming down, and it's an easy access. Just one time of learning and start practicing. Another key takeaway I would want to give all of you, take a candle, blow it, sit with that candle and just focus on that light. Every day, if you can practice this for 5 to 10 minutes, please, I would share my number with you. After a few days, do ping me and let me know how are you feeling. I can vouch on that. It again calms you down naturally. You don't need a therapist there. These practices have been our yogic practices. If we do that, there is a whole game changing. Your intuition level goes strong. Your decision making goes, powerful. I'm a leadership mentor and leadership trainer as well. I've worked with leaders and we have introduced spiritual leadership in corporates. I've had great brands accessing on it. Trust me, if you practice Tratak, the candle gazing, every day for 5 to 10 minutes, it's gonna make a change in your life. So to this moment, I can share this much. Rest, we can always connect. Sorry for taking the time.
That's a fantastic note to close the session. You've been given entrepreneurial view on mental health in India from the leader of mental health illness hospitals here with Dr. Jyoti. We've had personal experience that's been shared by Ibrahim. Thank you very much for that. And Sheena's given us some low-cost, simple measures that you can try, even though affordability is an issue, so that we employ preventative techniques rather than remedial ones. I'm going to just do a quick exercise because to just increase the energy in the room, and I can see very active listeners all around. So I think the session has been good because active listening is a good emotional health skill. So this quick round is only to be answered with one word or one phrase. There is no, you can't be answering with it depends. So each person is going to tell me what this means to them. Difference between resilience and emotional suppression.
Resilience is a positive way of dealing with things. Emotional suppression is actually a negative way.
Very good.
Can I add to it? Emotional suppression is not treating.
Not treating.
Not
Fair.
acknowledging.
Okay. Most healing relational experience. Ibrahim. Most healing relational experience.
Healing relational experience.
Sharing.
Okay, fantastic. Emotion that often precedes transformation.
Apprehension.
Okay, very good. Lost something. Strong people don't feel anxious. True or false? Strong people don't feel anxious. True
False.
or
False. False.
Very good. On that closing note, we have agreement, and thank you very much for this enlightened panel. I am really privileged to be the moderator here. And thank you to KMA for this opportunity.
Thank you, Dr. Nagesh. Thank you, everybody.
Well, thank you. Thank you. A very deep thinking session. Thank you, Dr. Nagesh Gaunikar, both for your keynote as well as moderating it. To our panelists, thank you very much. To do the honors, everybody, I'd like to call upon to present a memento to our very distinguished panel and keynote speaker. Can I have the President, K. Hari Kumar, Senior Vice President Convention Chair, Mr. Aljaz Khalid, please come by up, along with past President Jibu Paul and past President Bibu Punaran. Can I please have you gentlemen join us up on stage? Jibu Paul, past president, and Bibu Punaran, another past president. Meanwhile, please get on to the app, and we'd like to see you sharing your time and your thoughts on the poll that's now active. And our winners coming up to receive their prize, Samira and Dr. Manoj. Can we please have you make your way? Ladies and gentlemen, here we have Ma'am Samira receiving a prize, as well as Dr. Manoj. We're preparing ourselves for that grand valedictory session which will happen sooner. But ladies and gentlemen, without wasting any further time, cultural transformation for strategic impact. May I invite Managing Committee Member and of KMA and Managing Director of H3 HR Consultants Private Limited to introduce the keynote speaker. Ladies and gentlemen, Mr. Abraham Alikal. Sir.
Ladies and gentlemen, good evening. It is my privilege to introduce our distinguished keynote speaker for this session, Mr. Raj Raghavan. The theme is Cultural Transformation for Strategic Impact. Mr. Raghavan is a highly respected people leader with over 3 decades of experience working with global organizations. He is also an independent director and NRC chairperson at Healthcare Global Enterprise Limited. So he is currently working as a Chief People and Culture Officer at Costac Inc. He is also an independent director at NRC chairperson at Healthcare Global Enterprises Limited. Prior to this, he was working with Indigo Airlines, where he was leading the HR function. So he was leading the HR function during the period of remarkable growth. He has also held very senior and leadership positions at companies like Amazon and Hindustan Unilever, HSBC, Ford Motor Company, like that. And he has managed regions like, apart from India, Asia Pacific and Middle East. He holds a master's degree from Madras School of Social Work. And he is also a global fellow in talent management from Wharton School. Known for his ability to connect strategy with culture and performance, his insights are truly valued across industries. So ladies and gentlemen, please join me in welcoming Mr. Raj Raghavan.
Well, thank you, Mr. Abraham Alikal. Ladies and gentlemen, put your hands together for Mr. Raj Raghavan, Chief People and Culture Officer, Costac.
Thanks, Abraham. All right, thank you, Abraham, and it is such a pleasure to be back at the KMA event. I know it's the penultimate session, and a lot of you probably have to go home. So those of you that are staying back, let's have a conversation on how culture can impact organization success. My name is Raj. I work for, about 10 days ago, I started working with Reliance. I'm their group HR head supporting 2 Reliance businesses, Reliance Intelligence and the Reliance Consumer Products. Intelligence is based in Bombay and the Consumer Products Group is based in Bangalore. I live in Chennai, so I kind of travel most of the time. So for those of you that are staying back for the session, there is one more session coming back up, so you may want to just stay for some more time. The last two sessions, I should say, were probably eye-catching as well as very revealing. The one Dr. Nagesh chaired on well-being, and prior to that with Dr. Gaitonde. I think one of the things that we always see is the emotional wealth is not really seen as a financial wealth, and where we get there. And if that is more than good enough, we can now turn our sights into culture. I've now worked for over 30 years. I've worked in several different organizations, and I think in the last few years or so, there has been a lot more perspectives that have changed than it was even about 10 odd years ago. Now, what started as a change was COVID, right? Each of us have had our own impact on COVID, and what has then led to, especially on the technology industry that I've been on all the time. Now, between 20 and 24, I think lots of things happened. I was at Indigo at that point of time in 2018 to 2023, and we were just growing someone was saying, you're buying airplanes like you're buying grapes on the roadside. That's exactly what was happening. To then coming to COVID, and then we started seeing 2 months of non-activity. And each day when planes did not fly, the airline lost 40 crores. So that amounted to almost 7-8 quarters of continued issues and travails that we all had. But I think beyond that, it did not stop. If you see the year 2022, 2023, the number of jobs that were lost just in the USA were humongous. And to an extent that, I went to this startup, CoreStack, about 3 years ago. And, before I started in January 23, we had, funding that was just coming like, water out of the pipe. And then it all started drying down. So lots of things happened. And as we speak today, tariffs that the United States is imposing on several of us, including India and other major countries, is going to have a big impact. Now, there has been talk about recession, the US economy especially, but I think with tariffs, there is a lot more monies that's being thrown into the US economy by the US government. Whether that is going to impact their overall financial situation, time will tell. But at this time, there's a lot of bravado that's happening in the United States. Now, of course, the USA's influence on geopolitical situation is going to be humongous. I don't think there's going to be a time when we'll all be able to sleep and say that, everything is fine and everything is hunky-dory because, Uncle Sam is going to do something or the other that's going to impact us. Now, let me talk about culture, and when I talk about culture, for some reason or the other, there is a lot of emphasis on HR. Now, whether there is a productivity issue in a unionized factory, or profitability issues in a technology company, other than the products, the CEOs always tend to think, hey, HR leader, why can't you help me increase company's performance? Why can't you do, enhance employee productivity skills? There was this beautiful question Dr. Nagesh asked the gentleman there on AI, whether AI will help in emotional health. And I think AI is being almost seen as a panacea for all else, right? I mean, anything to do with anything has got AI today. Now, you go back to how companies perform. End of the day, the customers need a product that works, right? Especially, in organizations that we are all in, commercial organizations. And the employee is looking for a workplace experience. Now, workplace experience is a very important component of why I come to work. In fact, my PhD thesis at ISB is exactly on workplace experience. how does my workplace experience impact the customer experience I provide? And I'll come up and talk about that on another day. But as we speak today, the biggest challenge that we all have is how do we align organization culture? And how do we have leadership manage employees' career aspirations? Because anyone that you hire today, the first question they ask is, what am I going to do 10 years from now? My answer to them is, let's figure out what we will do 10 months from now, and then we'll get into 10 years, 10 years from there on. In all of this, I think the most important part is leadership, be it culture, be it profitability, be it product, be it customer. End of the day, leadership is probably the key. And now, when I talk about leadership, I'm not just talking about top leadership here, I'm talking about all of us as leaders, right? So the question then I ask myself is, what is the role of a leader? Now, what do you all think? Quick response. What do you think is the role of a leader? Anyone? To bring clarity is what I hear. Anyone else? Motivate. Yeah, bring clarity, motivate, etc. So I worked in GE for a long time, and I don't know how many of you have not heard of Jack Welch, the legendary leader of GE. So I want him to speak to you and tell you what he thinks is the role of a... Can you get the audio on? Can we get the audio on for the video, please?
What is the role of a leader? Well, the first one clearly is to be the chief meeting officer. To let everyone in the place know where you're going, why you're going there, and most importantly, what's in it for them to get there with you. People like to talk about where they're going, why they're going there, but they always leave out the third thing. When you come into a new job and you say, we want to change. Change is great, we got to do it. You forget, people hate change. You got to explain what's in it for them to change with you. So be the chief meaning officer and give meaning to every one of those people that are out there doing that job, so that they understand why you're going where you're going. Yeah, and they know what's in it for them. Better job, more pay, more flexibility, maybe nothing, if you can't say nothing. But you gotta understand that's one of them. Another part of a job, your job is to not give all these directives and not be the person getting rid of the clutter. Getting rid of clutter is a huge deal. You can't all of a sudden have bureaucracy. Let's go here, let's go there, then have 20 rules to stop the employees from getting there. You've got to break down all those little silos that occur, all those little bureaucrats who are checking the boxes in some layers, slowing you down. You've got to be the person in the... We always use this analogy of curling. You see it every 4 years in the Olympics with the broom out in front of the thing. You've got to be brooming away the stuff that's in the way. You've got to be the chief broomer out there to get rid of things so people can act and do things. You've got to have, if you want to be, in my experience, and I've looked at thousands of managers in my lifetime, you've got to have a generosity gene. It's got to be in your body. You've got to love to see people promoted. You can't have a jealous vein where you can't, oh, Joe got promoted and I should have got that job, or Mary got this and Pete should have got it, or whatever. You've got to enjoy people's success. You've got to love people's success. You've got to get in their skin and really be excited as hell for them. You've got to love to give raises. You've got to be turned on giving bonuses. It's got to make you feel great. And not, geez, I gave him a bonus and I didn't get one that big. None of those feelings. You got to just get over them And if I look at all the leaders I've seen, the best ones I've seen have this generosity gene. Ask yourself, do you have it? Or do you have a little small gene in there that's killing you and give raises, killing you to see other successes and jealous in your body? You can't have it. Brush it out, clean it out. And then do you go to work every day, finally, to really have fun? Are your people having fun? Find all kinds of ways to win. There are small victories all the time, and celebrate every one of them. We found a way to bring a keg in on everything. Find a way. Find a way to make little victories big victories. And if you get a lot of little victories, you'll get a big victory when you add them all together. But think of the job that way. Work is fun. And your job is to make it fun if you're a leader. Don't be some grinding horse's ass. If you're a bore, slap yourself. Think of the excitement and fun you can have in your job. Make it fun. Be the chief fun officer. So in my view, you've got a huge responsibility, most of you. God gave you a job where you are responsible for people's lives. It's a big deal. You got families you're responsible for.
What did you think of the video? All right, yeah, that was one. Certainly, Jack Welch had a great way of communicating the way he would communicate. I don't know how many of you have had a chance to interact with him. I was lucky to be in his classes at least 3 or 4 times during his time. I think a few things that I really liked about this video, and I keep using this video sometimes in my other sessions as well. I think much like the wellness part that we all saw, which helps the human body, I think leadership is the one that creates the cultural ambit into how organizations succeed. And I think to that extent, Welch can't be wrong. So there is this whole cultural transformation we talked about. So I'm sure some of you have been a part of cultural transformations. I wanted to ask a question on what you think cultural transformation may be. Any quick responses? If you've been in a cultural transformation role, I saw my friend sitting right next to me. He works for the UST group. What do you think cultural transformation is? One or two words? Changing behavior? Changing mindset? Anyone else? All right, in my mind, it is about intentional processes. How do you create intentional processes that reshape values, define how people in an organization think and act? So in the next few minutes that I have, and I have 16 more minutes, I want to give you some examples of what I have been able to do in the organizations that I've worked in. Now, one of the things when someone asks me, what is this organization impact via culture? Because culture is often seen as this, stuff that you can never put your hand on. It is always one person's view on another, et cetera, et cetera. But I think it has tremendous impact on the bottom line of a company. First is, it helps you build a high-performance culture. And that means it can work for any organization. I can be a food service agent, and I could be a high performer as much as if I'm an AI scientist working on. Now, there was a time in GE, I don't know if they still use this or not, they had this program called Session C. Now, what they did was, while they were planning for business outcomes, they always knew that unless and until people outcomes were baked in, business outcomes can never happen. And so they had this process called Session C, where there was a business plan, and then they talked about all the people. They did that for almost like 3 months at a stretch, and then every quarter going on, basically to talk about how people and culture will impact the business outcomes of the company. So I think that's a great way that you would have. And my own experience, I've worked in. I started working many years ago. My first job was a factory personnel manager at Unilever. Then I went on to work at Amazon, GE, etc., etc. And each of those had terrific, impact on not just me as a person, but also on the teams. My very first role was right out of college. I was in Madras School of Social Work. I went to go work for Brook Bond Lipton those days. And after about 6 months of training, they put me into this factory called the tea and coffee factory in Gatkesar, which is back of the beyond those days of Hyderabad. I walked into day one and I realized I was about 23 years old then, and I was replacing a gentleman who was 58 years old who had just retired. Now, the cocky person that you all are, I thought, what a big job that I got. The person that I replaced was the age of my father. I did not quite realize nobody wanted the job. And so they gave me the job. And as I just walked into my office, there was this gentleman that was brought to my office. He was actually bleeding from head to toe. He was all of blood, and there were some 20 people around him. And they kept shouting, "Call the police, call the police." So the union had, the factory had 3 unions, and each of them, did not like each other, and none of them liked the management. So there was this tension, anxiety all the time, the one Dr. Nagesh was saying. So I said, you don't need the police, you actually need a doctor. They did not appreciate my humor at that point of time. But the long and short of it is, later on, my 3 years spent at Gatkesar was all about how we brought people together and how the factory became probably the best productivity that they ever had among the older factories of Brook Bond Lipton. And they were almost like 80 years old at that point of time. And lots of other examples from GE and Amazon. Amazon was another great cultural example. The first time we had Amazon.in was in 2013. And there is this concept called the peak in Amazon. Peak is when you have lots of sales happening. In our case, it can be Deepavali, it can be Onam, it can be Pongal, depending on where it is. And at the very first peak, we realized that we did not have enough people to deliver goods. And so we said we will bring everybody who's sitting in offices like me, who generally were thought of, sitting and doing strategy. We said, we'll bring all these people and let them go deliver goods to people that actually bought from us. So my team was saying, Raj, you will never be able to go house to house. So we will allow you to just go to this corporate office and deliver, stuff that the office people had actually ordered. So I went to the Wipro office in Bangalore. I had a big car those days, so I took all of those. And I've been to Wipro a lot of times. But this time when I went, the security guard at the gate asked me, "Who are you?" I said, "I've come from Amazon." He said, "Delivery boy?" I said, "Yeah." Then he said, "You can't go this way, go the other way." So I went all the way back and stopped the car and then started calling people who had ordered. This was way back in 2014. And I called and I said, "Hey, Abraham, I brought your package. Can I deliver it to you?" "Don't call me now. I'm in a meeting." I said, "Sir, it's your package." Tatak, he cuts the phone. And then I call another person. I call Prajit, and he says exactly that. But the third person, Elgers, let's say, answers, and he says, "Oh, yeah, I'll come and pick it up. Where are you sitting?" I said, "I'm in the car park." So the moment, LGS came, some 20 people around him also came, and then I could easily deliver all that stuff. And that taught me 2 things, right? Delivering stuff is not easy. We all think it is a 10-minute job. It cannot be done that way. And the only way you learn is when you're doing all of these things. Now, coincidentally, it so happened that the CHRO of Wipro is also a good friend of mine. So at the end of delivering all of this, I called him and I said, "Hey, Saurav, I'm here in your office. How are you doing?" He said, "Hey, great. Why don't you come in here?" And I went and met him. And he asked me, "So what did you think?" I said, "Well, I think 20% of your workforce works and 80% are shopping on Amazon." So that said, there were things that we did in Amazon. Amazon had this very interesting plan. Whenever they hired a new employee, they had something called a launch plan. So they use words which were not very typical of what you hear in corporate America or corporate India. So the launch plan is like when you launch a product, what do? You have all kinds of support coming to all kinds of people. So the Amazon launch plan basically had a 90-day plan. During those 90 days, you were in what is called a witness protection program, which basically means you can find anything wrong and you will not be held responsible for it. Look at the culture they create. The culture they create is, come and tell me what's not working. Of course, you should also tell me what's working, but tell me what's not working so we can fix it. Even if it means it was in your own function, I'm not going to come and tell you that, you have to do this and you should have done this otherwise. I have lots of other examples, but I want to give you one or two examples. Again, going back to my working days. So at Indigo, and I know, a lot of you are going to smirk and say, 2 months ago, the whole company, shut down for 2 days. But I still think it's one of the best run operational efficiency, focused companies that you can ever see. So as the CHRO of Indigo, I also had responsibility for training. And the training academy was called iFly, I-F-L-Y, iFly. And the training leader outside her office had a board that basically had all the courses listed. So there was something like 70 courses being run every day. Not because, we were philanthropic about training people, but, you had to do that by way of statutory, regulatory reasons. So at any point of time, there were at least 50 courses being run. And at any point of time, at least 20 people attended each of these courses. So which means you had 1,000 people in the training academy. Now, the lunch hall of iFly could only take 200 people. Now, you have 1,000 people there, and you had to be on time. And so what we did was we split the lunch time. So the first lunch started at 11:30 in the afternoon, and the last lunch started at 2 o'clock. Now, if you were supposed to be at a 12 o'clock batch for lunch, and if your course overran by 30 minutes, bad luck, you'll have to go without lunch. So the efficiencies were just in. The other interesting thing was the training leader had this board which had all the courses listed with yellow, green, and amber, green, amber, and red. So any course that started on time was a green. Any course that started 5 minutes late was an amber. And any course that didn't start in 5 minutes was a red. Now, what does this tell us is being on time was a wonderful thing. And that's what Indigo kept saying all the time. And we said, if we can't do that during the training period, the culture doesn't get passed on. So some great simple examples of how your culture can get can really help getting business outcomes. Now there are lots of pitfalls that you can avoid. I had some more examples as well, and one of the examples was again Amazon's Customer Connections program. And the Amazon Customer Connection program was like this. So each of us work in Amazon, even for 10 years, that's fine. But every year, you had to undergo a 2-day program, which was called Customer Connections. And your job was to be sitting on the phone, listening to customers and solving them. So you had to be a customer service executive as well. So one of the things that they did. Now, there are a bunch of pitfalls, and of course, not using business metrics and all of that is there. Now, again, I'm going back to Amazon, and they had this very high bar to hire. I don't know how many of you have attended an Amazon interview for being selected for a job. They said, and I don't know how many of you are HR leaders here, you're probably running businesses of all sorts, but I still do believe that your most important job as a leader, be a business leader, HR leader, finance leader, marketing, whatever that is to hire the very best and develop them. So I think that is one thing I learned from Amazon. And finally, I do think that culture building, people strategy, business outcomes, all of them are almost the same on the same line at different points. And you need to be able to integrate all of them coming in together. And I want to, given I'm in HR, I want to close this with another quick video from Jack Welch, and I hope the audio will work.
You know, HR is, without question, one of the number one or number two most important functions in a company. I happen to believe it's number one. Many others think finance is the key to success in a company. HR is the driving force behind what makes a winning team. We make the argument that the team that fields the best players wins. HR is involved in making sure we field the best players. That's their job. And their job is to sit in every meeting, be involved in every part of the business equation. They're not the health and happiness, picnics, benefits team. They're the development team, developing today's and tomorrow's leaders. And then if you have an organization where HR is relegated to forms and benefits, you got the wrong game going. I like to use one analogy. If you were running a sports team, whether it be the New York Yankees, the Boston Red Sox, would you like to hang out with the head of player personnel or the team accountant? Who would help you build the best team to field? Not the team accountant. Same thing's true in business. You get yourself a great HR person, preferably one with multi-skills in manufacturing perhaps before, or in sales, who happens to be a people person, who understands that the role of the HR leader is to be both pastor and parent. Pastor in keeping secrets, and parent in telling it straight. You get that person who loves to see people grow, and you've got yourself a winner.
So I'm going to finish 2 minutes ahead of my schedule in true Indigo way. But those of you who are in HR here, you know, we all should feel very proud of what we are contributing to organizations. And we also should feel a sense of responsibility towards what we intentionally and unintentionally do. You know, in my mind, the biggest disservice we can ever do to an organization is to say, let them hire whoever they want. Let them pay whatever they want to get paid. Let them develop the way they want to do. I'm going to do my little bit of, you know, running my payroll, my benefits and all of that. And I think that is the biggest disservice we can ever do to ourselves. I think there are some great examples of how HR leaders have transformed organizations. Google, for example, I mean, they had some really deep research that went on in terms of, you know, people and their productivity, etc. You know, there's another example from Motorola, and I'm told that when the peak of Motorola happened, there were a lot of people that were leaving Motorola, going to a competition. And the leadership there did not think it was competition. They thought they were all going to this computer company. And what is this telephone geek going to do in a computer company? Little did they realize that these people are going to Apple, and Apple was building iPhones, and Motorola was losing people, you know, with deep insights into telephony and technology. I think these kind of market intelligence can only be brought in by HR, and I want to close this by thanking KMA for another opportunity, and hopefully it was a good half an hour spent for all of you this evening.
So can we see you right up on stage? Ladies and gentlemen, a round of applause, please, for Prince Anthony while he joins us to hand over a memento to our speaker. Thank you, Mr. Prince Anthony, for handing over that memento to our keynote speaker, Mr. Raj Raghavan. And our winners for our penultimate one, Shrikant Nair. Of course, you should be there. He comes by. And Arun KL. Ladies and gentlemen, can we have a round of final keynote address to introduce our final speaker for the second day of the 53rd edition of ClaySys KMAC. I'm calling upon the Managing Committee Member KMA and CEO Lakshman Das and Sons to introduce our keynote speaker. Can I please have Mr. Deepak Aswani come by? Ladies and gentlemen, Mr. Deepak Aswani.
After such a heady and a fulfilled convention, obviously one would like to have a dessert to round off a wonderful ClaySys KMAC convention. And who better to do it than one of the most sweetest management professionals in the industry, Mr. Naresh Kumar Sethi. It gives me immense pleasure, and I must admit, a touch of personal pride, because I've known Naresh for almost 35 years. When he came into the industry in his jeans as a sprawling youngster, and from that, he has gone on to places. He's been not only a great global business leader, but a friend whose journey I followed with admiration over the years. Mr. Naresh Sethi is one of those rare leaders who combines sharp strategic intellect with deep humanity. In a world increasingly obsessed with speed, noise, and buzzwords, Naresh has always stood out with his clarity of thought, which you're going to see on stage today, his calm conviction, and an unwavering commitment to doing the right things. In fact, for this presentation himself, he's been in preparation for the last 2 weeks, and I think he's in touch with the KMA team. I've been almost every other day trying to perfect his presentation. Our association goes back a long way, almost 35 years, and what has remained constant through the years is his value system. Be it in Japan during the tsunami, or in Lagos in Nigeria facing guns, he has always stood by his team and has been an able leader right through. Whether leading businesses across continents or mentoring CEOs and boards, he brings to every role a deep respect for people, customers, and culture. Titles have changed, geographies have changed, industries have evolved, but his principles have never changed. Professionally, his journey is nothing short of an extraordinary. From his early years at ITC to leadership roles spanning over 70 countries, to serving on the executive management of one of the world's most respected FTSE companies, Naresh Sethi has been at the forefront of global business transformation long before it became fashionable to talk about it. As chairman of VST Industries today, and as a trusted advisor to some of the world's leading organizations, he continues to shape conversations around strategy, digital transformation, and customer-centric growth. What truly sets him apart, however, is his ability to bridge worlds, the world of technology and the world of traditional enterprise, the world of shareholder expectations and the reality of rapidly evolving customers. He understands that while technology can enable change, it is leadership, culture, and courage that ultimately make transformation successful. An IIT and an IIN alumnus, a global CEO, a board leader, and a mentor to many, yet always approachable, grounded, and generous with his time and insights, that to me is a mark of a truly great leader. You've all known about the series that's come into season 4, The Family Man. And Naresh, I think he should have replaced Manoj Bajpayee as the true hero of Family Man. He's got a wonderful family, married to Asha, and a lovely daughter, Ananya, who's also married, like Aljo's son-in-law. She's a British-American son-in-law. And he dotes on them. At a time when businesses are navigating uncertainty, disruption, and exponential change, I inspired and possibly have a good chuckle or two. So, ladies and gentlemen, sit back and prepare to be educated, inspired, and possibly have a good chuckle or two as he delves into his keynote address titled The Kakadmi Paradox, Leadership in an Exponential World. Trust me, you don't want to miss a single word. So I here welcome Naresh on board. Please give him a big hand.
Well, thank you, Mr. Deepak Aswani. And yes, we prepare and set the stage.
Thank you. Deepak ji, thank you so much. You've always been extra kind to me for the 35 years that you've known me. And you've set me up for a loss here, I can see. But good luck to everybody who's still here. I'd like to also thank KMA. Algiers, where are you? Yeah, for inviting me. Thank you so much. And of course, my partner in crime, Lieutenant Jacob Jojo. I can't see you. You're still helping me, I know. Thank you so much. All right. I've just one simple objective today for this session, and that is to plant a seed of doubt, a little bit of uncertainty. Because I think if planted right, this uneasy discomfort always propels us forward. It moves us forward as individuals or as an organization. Okay, so let's start with a simple exercise. What do you see? Just think about it for a second. So when I run these small group sessions, the standard answers I get are pretty typical. It starts with travel, then they quickly start to frown and say business travel, or they'll start to smile and think of family holidays and the fun that they had. And the next they start to go into comparing airlines, which one is better, which one is worse, where the food is good, where the food is bad. Oh, these days the legroom is not good. All the rush and the madness at an airport, so on and so forth. Not one person has ever said, wow, how can this metal tube weighing 80 tons take off from the ground and fly? Isn't it amazing how incredible magic can be normalized? That's what we humans do, you know. We adapt, we make progress, and we move on. And we've been doing it for a very, very long time. Throughout our history, humanity has moved forward on the back of the crazy ones in our midst. The misfits who keep asking why, the rebels who keep challenging why not, the troublemakers, ones who see things differently, who challenge the status quo. They change things. They push us forward. We owe so much to these change makers who have come up with ideas, inventions, discoveries, and they have changed our world. And with these changes, human beings, organizations, and society have also learned to transform. And transformation is not new. It's been going on ever since we learned to harness fire through the Industrial Revolution. Then came steam, electricity, computers came, the internet, mobiles, and now the digital era. There has been one feature, however, of all the revolutionary changes that have happened till now. We have had time to adapt. This process of transformation sometimes took a century, sometimes it took a couple of decades. But I'm here to give you one simple message. This time, it is different. All that we have seen in human history will pale in comparison to what we are going to see in the decade ahead. And to make that idea come to life, let's play a small game, okay? So, I just want to pick two people. There is Deepak ji, of course, in Algiers. And let's say you split Algiers, you'll represent this half of the group. And Deepak ji, this side of the group. And the good news is there's money involved. Do you have a color? Pick one. Okay. So this side of the room is going to get money based on the selection that Deepak ji had. That's blue. And Algiers team is red. Okay? So what does the red team get? Congratulations. 1 lakh rupees. Everybody down the middle on this side, 1 lakh rupees. That's brilliant. I think I have something still left for you, Deepak ji. And you get an even bigger amount, that's 100 rupees. So this side of the room gets 100 rupees. No applause for that? I'll remember you. Well, I ran out of money. Algiers, he called me first and what have you. But let's then put another condition. You can't have this money for 20 years. And Algiers, I'll give you a good rate, 10% growth every year. And because 100 is like literally nothing, that'll be just double your money every year, okay? So you've been so nice to me already, so let me just double it for you. So let's see what happens. In the first 5 years, well, 100 has become 3,200, Deepak ji, not bad. And Algiers, you're swimming, 1 lakh has become 1.6 lakhs. Let's move on and let's see what happens in 10 years. Not bad. You're still at 1 lakh, the money I gave Algiers already at day 0. And Algiers is doing well, 2,59,000. Let's move on another 5 years. Whoa, 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 whoa. Around year 12, I can see Deepak ji. Can we have another applause this side, please? Out of nowhere, 100 rupees have become 32 lakhs. Now, we've run out of screen size, but let's see what happens in another 10 years, year 25. 335 crores is what the doubling of a simple 100 rupee note gave you. And steady as she goes, sorry Algiers, you're at 10.8 lakhs. You know, what's even more impressive is in the 26th year, 335 crores become 670 crores. Hopefully you have learned by now that you shouldn't trust a guy who gives free money during presentations, or why you should not take a mathematician to a card game. But I think you begin to understand the word that has been used today on what exponential is. When change is exponential, there's a long period when literally there's a trend bubbling up and you can't even notice it. And the minute you start to see it, the deceptive growth is already at an inflection point on its way to being disruptive. It happens so quickly that there is no time to react. Now, we humans, on the other hand, we have evolved linear. When we see change, we process it, we forecast it, all in straight lines. That's how we have evolved. Our brains are prediction machines built for a world that no longer exists. We are running ancient software for modern problems. And so far, it's not been bad, it's worked for us. We found that it's wise to wait and watch. Let's see how the change is. Is it impactful or not? Will it last? And then so on and so forth. And then we act. All I'm saying to you now is that we have to fight this instinct now. I've spent almost a decade researching trends and their potential impact. And what I see is exponential changes with potential impact far greater than any change we have ever seen in our human history. If the lights were on, but at least in your hearts, I can almost see people shaking their heads and say, here he goes, all this hype stuff and what have you. So let's try this. Go back to 2011. 15 years ago, if I told you, whether you see a family or a group of friends sitting in a restaurant or people sitting in waiting areas, that all of them will not be making eye contact, but sitting there glued to their mobile phones. Would you have believed it in 2011? That you would be banking primarily via your mobiles, you'll pay friends, shops, the fruit wala on the streets, and even beggars with QR codes. Would you have believed it in 2011? That making calls and messages will be free? That people will be able to work from home? 2011, work from home? Run meetings, sitting in their pajamas on their dining tables? That you could literally buy anything from a paper cup to a big screen TV, the click of a button, and expect it to be delivered the next day. And these days, sometimes it is, if I've ordered something, I'm going to receive it in 10 minutes. In 2011, would you have believed it? That there will be, that you could order food from any restaurant in your city. That you'd be tracking your sleep, your heart rate, your steps without making any effort. That entertainment will be ubiquitous. And there'll be a generation of content creators from all segments of society being seen by people all over the world. That food porn and cat videos would become a thing. I think you get the idea. We are not good at noticing or accepting change that has gone by. Almost unknowingly, we adapt and move on. And magic becomes ordinary. So please have this in mind when we look ahead, because we are currently seeing not one, not two, but 4 or 5 tectonic changes riding the exponential curve well past the initial phase when you can't see them. What's even more interesting is all these are aiding and abetting each other to move on faster and faster across the exponential curve. Over the next decade, the world will be a completely different place. The speed and impact will be unprecedented. The change will bring a new paradigm or multiple paradigms, all at play at the same time. Exponential is the new math driving the world now. And we all better learn it. These changes will impact our homes, our businesses, our politics, our daily lives in ways we have not seen before. And let me bring it home with some practical glimpses of this future, starting, of course, with exponential intelligence. We've been hearing this word all day. AI has exploded as the hottest topic of our times. ChatGPT, has kind of become shorthand for it. And do you know that ChatGPT celebrated its 1000th day a few months ago? and we almost do not know what life was before ChatGPT. We are now seeing, as you can see here, a race for winner takes all between companies, and do not underestimate, between countries as we speak. In the US alone, $1 trillion have been spent in the last year and a half on AI and AI infrastructure. 25% of the GDP growth of the US was on the back of AI investments last year. The world is putting its money where its mouth is. And that is not to help some graduate do his or her homework. Today, most AI models are already smarter than a human being. In terms of languages, they speak hundreds of languages. No one human being can match up to them. We are seeing subject matter expertise already, far better than any human. By that I mean whether it's medicine, chemistry, physics, biology. So all of us today have a world-class scientist, if we want, sitting in the palm of our hands. And even as we speak, these models are not staying where they are. They're constantly evolving, constantly growing, literally on a week-by-week basis. Employment is a major topic of conversation, and I heard this mentioned during the day, especially today. It's quite clear to me that human capital is on its way to becoming obsolete. By that I mean knowledge jobs are at huge risk. And tech changes in our history have always increased jobs. So many of you might have seen the McKinsey study that said during the internet era, for every one job that was lost, 1.6 new jobs were created. That has been the mantra with every revolution that we had, right through the last 150, 200 years. That model is gone. For the first time, we are going to see a net reduction in jobs, especially knowledge work. And there is painful displacement ahead. And the business case is undeniable. AI offers a 24/7 hyper-productive workforce that doesn't complain, doesn't have coffee breaks, doesn't need HR, doesn't want pay raises, and what have you. It's cheaper, better, faster. Industries built on human capital alone, for example, BPOs, or any knowledge worker who primarily works on a computer needs to get worried. And a big revolution that has happened in the last year and a half is voice. The simplicity that voice brings. You no longer need to learn computing, how to use a computer. You now can have massive intelligence on your mobiles, and all you need to do is speak to it in your language. This is a huge breakthrough because this is going to be a big leveler. Let me give you some examples. Imagine a personal, infinitely patient AI tutor for every child, customizing learning to their strengths and weaknesses in their own language. The beauty is that the same opportunity is available to a child in a remote, illiterate rural area as to a child in a bustling metro. The barrier to learning is on the cusp of being erased. I was reading the other day, El Salvador has signed up with Grok AI. And from what I know, this will be the first time that a nationwide personalized tool will be available in the public education system. So the experiments have started. This is not sometime in the future. Likewise, and this excites me, especially in India, we can provide every rural doctor with an AI assistant for world-class diagnostics and treatment, even in the remotest of areas. In my mind, all things being equal, in the developed world, it'll soon be considered malpractice for doctors not to use an AI co-pilot for diagnostics or treatment, utilizing the latest science, because we know science is evolving fast. AI is also accelerating the drug discovery. So Big Pharma is investing heavily in AI. Moderna vaccine would never have made it in that record time if it was not for AI. AI has taken educated guesses out of drug discovery, and that is changing the entire pharmaceutical industry as we speak. Keep going. If you look at law, again, a great leveler, because now any lawyer with research can stand up to any well-funded, highly resourced law firm. AI judges, who knows? They may soon be able to process, at least to start with basic cases like traffic violations, contract conflicts, and reduce the backlogs in courts. The world of finance has been seeing a massive revolution over the last 5-8 years with fintech. To give you numbers, the top 20 retail fintechs today serve about 4.1 billion consumers, whereas the top 20 retail banks are at 2.7 billion. AI is really accelerating this shift. And it's also challenging the very notion of currency, whether you start to think of bitcoins or stable coins, so on and so forth. So that's AI. Let's move to robotics. You've heard of autonomous cars being trialed in the US with amazing results. And China actually is doing way more trials. And these are happening on a much higher scale now. This basically means mobility for everybody. Let's look at the implications. The elderly, the blind, the disabled. Enhanced safety, since 94% of all accidents are on account of human error. Traffic efficiency, wouldn't that be nice in my Bangalore? Total urban redesign when you don't need parking spaces. And the ultimate demise of the generation-proof dream of owning a car. And the economic shifts will be significant. Reduce costs on the one hand, but job losses on the other. Drivers are the single largest employment category in the US in the workforce. And they are roughly top 5, top 6 across the world. This is Neo. Robots are coming to our home. Neo will be available in 2026 for $20,000. A robot that cooks, cleans, doesn't judge you for your life choices. Yeah, what's not to like? The challenge, and there's been a lot of progress in the last 2-3 years, has been electromechanical dexterity. And we are now seeing very good results. Human-like robots with 140 facial movements, robots with hand movements with degrees of freedom to match the complex human hand. And in 4 to 5 years, I promise you, androids will be more and more commonplace and will become cheaper. Same thing when you go to factories. Boston Dynamics and Elon Musk's Optimus robots have now announced plans to ship humanoids on a massive scale in millions. All the learnings actually that Tesla has had in the manufacturing of cars are now being applied to create these robots at scale. But this actually is a huge hardware challenge and that has been cracked. Because the next step is very easy. Next step is for these robots to learn from their environment and learn from us. As this trend is just picking up, you can imagine the debate now, which year would the robots, the population of robots, take over the human population? An amazing revolution is happening in brain-computer interfaces. Neuralink, you must have heard of it, is one of the pioneers. The goal here is to get your brain to bypass any limitations due to injury or disrupted neural pathways. They insert a coin-size implant with microfibers in your brain. And 5 people are being tested as we speak. And you'll see a video of Nolan in a second, who can move a cursor, play games, write emails with just thought. And he's faster than his more able friends. There he is. The time is not far that machines are really, this brain interfaces are really going to help us. So what happens if you have a spinal injury? You lose control of your limbs. But now what science can do is to bypass the dead neurons and pass on the instructions from your brain straight down, and you start to get use of your limbs all over again. And just to blow your mind, now we are talking of bi-directional feedback with robots, which means you can get inside a robot's head. So whatever you're thinking, the robot is doing. And for the first time, what this is doing is leading to an abundance and a huge reduction in costs. The future is going to be deflationary. The cost of services that are always tough and they keep growing with time, like education, healthcare, entertainment, they're all going to come down, and in some cases be close to zero. This is a paradigm collapse. Now if we move to biotech and longevity, I'm most excited by the developments here, especially longevity. Maybe it's got something to do with me turning 60 this year. And the phrase longevity escape velocity is now becoming more and more commonplace. So what is this? As longevity escape velocity. So basically, given the advancements in science and medicine, for every 1 human year that we live, today we get about 3 to 4 months back. So the concept is that in 10 years' time, that's the forecast, that for every year that we live, we're going to get a year back. That is when we hit escape velocity, and then you start to get more than a year back. So we begin to live longer, reverse aging, and living to 100, 130 in the best of our health. Think of the implications of this one fact alone, if this comes to pass, on our society, us, our lives, our careers, pensions, family lives. Let's keep going. And this is possible because now AI, nanotech, regenerative medicine, gene editing with CRISPR are fixing precisely the genetic errors that lead to aging. And now we have nanobots capable of patrolling your body, targeting and killing disease, for example, cancer cells, and repairing cellular damage. I want to quickly move to energy now. We need a huge revolution in energy. And we had this conversation in the second session this morning. Because what's also happening exponentially, that's not that great, is all the issues that are going on with climate change. And if we don't do something, we might be living in a very different planet very soon. So there's a lot of work going on how science and technology can actually help us in this effort. For example, how to reduce emissions. But energy, clean, cheap energy is one massive idea. And there are two ideas there, solar and fusion. Solar is fantastic because even a fraction of the sun's energy is enough for us to do whatever we need to do for however long as we want. The problem, however, is the sun is not available all the time. There's something called nighttime, and during the day you got clouds. So here's the idea. Why don't we shoot satellites into space, cross the Earth's atmosphere, get non-stop solar energy, and beam it back to Earth? Every science fiction movie I watched as a child looks like it's becoming a business plan. And the satellites are going up. Japan, China, followed by US, the third place, are pace setters here. We've left the research phase in this example and are entering engineering prototypes. Now, data centers suck in a lot of energy. And in 2-3 years' time, data centers are going to be sent straight to space via satellites, taking solar energy and beaming back data to Earth, through lasers, of course. And this has happened. Look at how technologies overlap. The biggest innovation with SpaceX's Starship has been, in the past, to send things up into space costs you $10,000 per kilo. In a couple of years, we're going to be talking of $100 a kilo. So when people are saying we're going to have data centers and push 5,000 satellites into the orbit, the business case is there. This is a classic example of exponential trends aiding and abetting each other. Then there's fusion, and fusion is very straightforward. As you know, nuclear reactors use fission, our stars use fusion, and once fusion starts generating energy, it's a self-sustaining loop. Far more efficient and far more safer than a nuclear reactor. And this has been a difficult scientific challenge. You know, it can't happen. It's a hugely complex subject. But today, it's no longer 30 years away. It was always 30 to 50 years away. And there's a realistic chance now that the private sector will be online before 2030. There's a company called Helion that has signed up with Microsoft, a contract for supplying energy, that is, and Commonwealth Fusion Systems that has signed up a deal with Google. And the word is that from 2028, 2030, they'll start putting energy into the grid. This is going to be absolutely massive. Come what may, in about 10 years' time, energy at mega scale and highly reduced costs will be a reality. I've shown you intelligence, robots, health, longevity, abundance. What I'm really describing is a fundamental renegotiation of what it means to be human. What do we do when machines do all the work? When they think? What do we do? What do we become when scarcity ends? What's a life when it stretches beyond anything we have known? These are not philosophical questions. For people in this room, these are planning questions. My job, I said in the beginning, was to put an element of doubt in your minds. While I may be sure of these trends, you must figure it out for yourself. Skepticism is always healthy. But remember, denial can be very expensive. Many experts say that the future could almost be utopian. Many have their doubts. One thing they all agree, that the next decade is going to be extremely turbulent. And as we business leaders as we business leaders know, where there's turbulence, there are huge risks. But at the same time, for the entrepreneurial amongst us, there are tremendous opportunities. So let me tell you a story of King Kakudmi. Those who know me know that I have a weakness for Indian mythology. So my team is always complaining that whenever I have any presentation, I bring in some of these tales from our epics. Today is no exception, and this story is from the Bhagavad Puran. As the story goes, there was a mighty king in the golden age called King Kakudmi, all powerful, and he had a most accomplished daughter, Revati. Like all fathers do, he said, I have to find the right groom for you, Revati, but you are too perfect. So what I'll do is I'll create a list, as parents do, and I'm going to go to none other than Brahma. So I'll go to Lord Brahma and ask him to pick one. So off they go to Brahmalok. And once they reach there, they find Brahma is listening to a musical performance from the Gandharvas. So they wait, the short performance ends, and Lord Brahma says, so Kakudmi, what's up? What brings you here? And Kakudmi says, you know, the time has come to marry Revati off. I've got this list of candidates. Pick one and I'll be on my way. And Lord Brahma says, I'm afraid it's too late. During this short wait, while I was listening to music here in Brahmalok, 27 Chaturyugs, it's about 116 million years, have passed on your earth. Whatever you were, whatever you thought there was, has all long gone. It's disappeared, it's all forgotten. And Kakudmi was absolutely gobsmacked, he was shocked. But then Brahma, being Brahma, said, you know, don't worry. I've got the right match for you, your daughter. Go down to earth, there is Lord Balaram, brother of Lord Krishna. He's the perfect groom for Revati. So they go down to earth, and then they realize that Revati was from 116 million years ago. She was a giant. So divine intervention was again needed to touch Revati to bring her back down to the human form of the times of Lord Balaram and Krishna. And off they went, and as stories go, and lived happily ever after. So the question is, why am I telling you this story? I think it's a great lesson for us as individuals and business leaders, and that is, timing trumps perfection, especially in the times when the paradigm is shifting. Inactivity now won't mean staying in the same place. It means literally going backwards. A strategy perfect for today is useless if it takes Brahmalok time to implement. There's a real risk that by the time your perfect plan is greenlit, the world has already moved on. Think about it. You may find yourself in a world where ecosystems have changed completely and end up looking like a slow-moving giant forced into painful restructuring, layoffs, divestments to survive a bit too late and survive if at all. And unfortunately, for us mortals, Joe, Lord Brahma is not around. He's not around there to help us. It's time that we humbly accept that models and expertise that have led to our past successes may now be irrelevant. Timing trumps perfection. And this fast-paced, changing environment, when suddenly confronted with disruptive change, I have seen many organizations, they just freeze into doing nothing. What in my world we call strategic paralysis. Surviving and thriving through the fundamental changes ahead requires a fundamental shift in leadership. What's transformation? Transformation is nothing without ambition. And ambition is nothing without vision. And how do you have a vision if you don't have the right sight on what the future holds for you? That is why transformation, in my experience, always starts at the top. It's only rebellions that start from the bottom. All of you run very successful businesses. The students are yet to, I know. I respect your experience and wisdom. You've been extremely good at what you do. We've heard countless success stories in the last couple of days. But I think that's what's going to make this very hard, because success is a terrible, terrible teacher for change. But I'm also sure that if leaders like you are convinced of the why, that there are changes ahead and you need to do something, and why timing is of the essence, you know enough, and with your experience, you'll make the right decisions thereafter. I invite all of you to become a child again. Relearn, reimagine, reconsider, reconnect, rethink. You have to challenge and unlearn all your assumptions. Sometimes the more senior the leader, the more locked in they are with their assumptions and their worldview. I mean, I've been most guilty of that almost all of the time, where I was always too proud to challenge stuff and said, I know best. I've been there, I've done that. So I know from personal experience, it can be hard. To understand and predict how the needs and wants of your consumers are going to evolve. What kind of environment, society will we be living in? What new challenges are going to emerge? What new opportunities must your organization place bets on? Unlike the past, you can no longer wait to adapt to these changes. And given the suddenness of these changes, I urge you to prodapt. Obviously, I made this word up. Many of my friends hate it, but I think you get the idea. Don't wait for the storm, adjust the sails now. Proactively adapt your entire organization, consumers, partners, and supply chain. You must adapt before the market forces you to, before your competitors, especially the new challengers, fill in the new spaces, leaving you in a vacuum. And finally, what's very clear to me is that the biggest barrier to transformation will not be technology. Funny that, but your people. If you do not have people trained and developed for the possibilities of this new world, technology is not going to save you. And given the pace of change, organizations will have to become the new schools, the new universities. You must constantly inspire and reskill your workforce. When the big changes happen, some companies are realizing it because they're too eager to rush into this AI buzzwordy game that's going on these days. When you rush into this too soon, it never works because your organization, your people are never ready to actually move with you, to move with the trend. And it's when all these things actually happen and suddenly we see the disruption in the exponential curve, it might be too late to start reskilling. It's almost like learning how to swim when the ship has started to sink. So finally, what are some practical recommendations that I have for you? I've talked about this. Reinvent how you create value. Think about your business model. And one simple suggestion that I have for all of you is to set up what I call a rebel task force. Some of my clients also call it the team I pay to give me anxiety task force. Basically, this task force is what? It's a group of bright people from your organization, tasked with devising as many ways as possible to compete against your own company. New products, new ideas, new business models, ideas that a newcomer or competitor could use to kill your business. I find this one of the most refreshing, energizing exercises that a business can take. And one of the best outcomes out of this is you get numerous ideas. And all of us know here that allocating resources while managing today and investing in tomorrow is a fantastic fantastic slogan, but very difficult to do in real life. But if you are productive, you have the luxury of time, an opportunity to create a culture of experimentation by placing these small bets regularly, continuously. No big plans, no endless meetings and reviews. Just go ahead and pick a few of these ideas, make these micro moves in your business or the marketplace, learn from them, they don't work, can it, move to the new one. Two things happen. Firstly, you're in the game. You're trying things and you're not at the same time betting your entire organization's future and resources on one sudden mega change, which is fraught with risk and rarely works. And best of all, you are building organizational muscle for the future. I'd also like you to challenge the decades-long wisdom of what an organization looks like. Neat boxes, role profiles, hierarchies, pay grades, career paths. The world we are getting to will be built around credibility and ideas, not hierarchies. The future belongs to fluid work, which is basically like the Rebel Task Force, forming flexible, output-oriented teams based on skill and capability, and not tenure or seniority. Because all you want to do is create value. And once goals are achieved, the team is disbanded and people move to new challenges. Form the best team, deliver the output, and disband. This is how bank robbery movies actually work. It turns out that the future is also going to work like this. So to conclude, let me tell you my last story, the rebirth of an eagle. This is the story of an eagle. An eagle has the longest lifespan of its species, up to 70 years. But to reach this age, the eagle must make some tough decisions in its 40th year. Its long, flexible talons can no longer grab prey. Its sharp beak begins to bend. Its old, heavy wings with thick feathers stick to its chest, making it difficult to fly. The eagle is left with only two options: to die or go through a painful process of change. The process of change requires the eagle to fly to a mountaintop and sit on its nest. There it knocks its beak against a rock until it plucks it out. It waits for a new beak to grow before plucking out its talons. When new talons grow back, it starts plucking its thick, heavy feathers. And after this, the eagle takes its famous flight of rebirth and lives for another 30 years. Why is change needed? To survive and live. We too must start the change process. We too must be willing to cast off our old burdens and endure the growing pains of transformation. Ladies and gentlemen, may you water the seed of doubt I've planted here today until it grows you into something new as a person, as a leader, and as a business. Thank you.
Ladies and gentlemen, Mr. Naresh Kumar Sethi. And we can safely say, sir, some talks gives us answers. This one gave us responsibility to think deeper, act wiser, and stay human as technology moves faster.
On behalf of the entire organizing committee, it's my distinct honor and pleasure to propose the vote of thanks for this successful management conclave. First and foremost, a heartfelt thanks to our esteemed former Foreign Secretary, Ms. Kumar Rao, for gracing us with her online presence and sharing such insightful wisdom of the current geopolitical landscape. Thank you so much, ma'am, for that. We extend our deepest gratitude to all our distinguished speakers and panelists. I'm not telling due to lack of time, I'm not telling each and every person's name. From Mr. Pramod Verma to Mr. Sethi, taking us, Pramod Verma, making us proud being an Indian, explaining the developments in Aadhaar and all, from Mr. Kumar Sethi, giving us a thought-provoking session of exponential way of changing things. Thank you so much, each and every panelist, for your valuable time and giving us such a wonderful day. Our sincere, we are sure that all the attendees had a great day, thought-provoking. Actually, the final session, all the sessions, our longevity exceeds the velocity. It's a great thing we have to think about. I'm sure that it's just a thought-provoking day, thought-provoking ideas on financial, physical and mental well-being, which will take us to the next level in our life. Thank you. Thank you for that. And thank you, ClaySys, for the partnership of this conclave. This is a journey to be continued. A big thanks to generous sponsors and partners whose support was crucial in making this event a reality. We deeply appreciate your commitment to fostering the management excellence. To our dedicated convention chairperson, Mr. Ajay Ali, and entire MC members, our organizing team, volunteers, and staff, both ClaySys and HIAT, your tireless effort, attention to detail, and seamless coordination behind the scenes deserve a special round of applause. You are the pillar of this event's success. And to our dear participants, your active engagement, thoughtful questions, and enthusiastic presence made this conclave a vibrant platform of shared learning. Thank you for making this a truly collaborative experience. Finally, our supportive management, our own Executive Director, Captain Lieutenant Jojo Jacob, and his staff, all the administrative staff, thank you for your unwavering support. We hope the insights gained today inspire us, all of us to lead with innovation and integrity. Thank you once again to everyone being here. We look forward to a continued collaboration and success. Thank you. And one more announcement from the management side. Our own Prajit is celebrating his birthday today. A very happy birthday to Prajit. Please come on to the stage. Prajit. This is small for him.